Is Akinwale Kehinde there?
Oh my God.
Oh, sir, sorry, can you take the available group that is available, sir? If that one is applicable, so that we will not waste our time.
Is Adeleke Oyinlola there? Is it that all the members of this group have gone out, or what?
Sir, I'm available. I'm here.
What's your name? Okay,
My name
Merlin
is
Daniel.
Yes, sir.
Please go ahead.
Okay,
Good
I'm
morning,
reading
Director.
from there.
Good morning, Director. Professor DK is already here.
Oh, Prof, good morning, sir.
Morning, sir. Morning, sir.
All right, thank you very much, sir, for being here.
Thank you, sir. Thank you, sir.
All right, sir. Okay, Merlin, can you please go ahead?
Okay, our topic is parental separation and adolescent emotional degradation in urban Nigeria. Implication for psychosocial interventions. Okay, from the abstract, parental separation has become an important psychosocial concern in adolescent development, especially within the urban settings where family strain,
What is
economic
happening?
pressure. Hello, can you hear me?
Oh my God.
We are hearing you. Please go ahead.
We are
Okay,
hearing you. Go ahead.
I'm taking it again. Parental
No,
separation
don't
has
take it again.
become
Go
an
ahead, please. You are
important
wasting time.
psychosocial. Okay, this article review recent literature on parental separation and adolescent emotional degradation in urban Nigeria, where attention to implication for psychosocial interventions using a descriptive review approach. We use the descriptive review approach. The paper examines studies published between 2020 and 2026 on family disruption, adolescent mental health, emotional regulation, and psychosocial support. The review found that parental separation is consistently associated with adverse emotional outcomes among adolescents, including anxiety, sadness, anger, withdrawal, behavioral instability, and difficult regulation emotions. The evidence further showed that these outcomes are often intensified by continued parental conflicts even after separation. Inconsistent caregiving, financial hardship, stigma, and limited access to supportive services. At the same time, the review identified protective factors such as supportive caregivers, school connections, stable routine, access to counseling and community support as important buffers against emotional distress. The article include that adolescent emotional degradation in context of parental separation should be treated as a significant social work concern requiring connected social response. It therefore calls for family sensitivity, school-linked and community-based intervention that strengthens emotional regulation, resilience and health adjustment among adolescents affected by parental separation in urban Nigeria. Our keywords: parental separation, emotional degradation, adolescent, urban Nigeria social interventions. This is our abstract. Should I take the introduction? Should I take other things? Hello?
We expected you
Hello?
to take introduction, but you've taken abstracts. So you just wasted our time. But go into introduction in 2 minutes.
Okay, introduction. Adolescent mental health has become an increasingly important concern in health education, social welfare discourse. The World Health Organization reports 1 in 7 young people aged 10 to 19 lives with mental disorder. In contrast, depression, anxiety, and behavioral disorder remain among leading causes of illness. Among these important notes This is important not only because of the immediate emotional burden carried by adolescents, but also because untreated mental health difficulty, often split into school adjustment, relationships, help seeking, and later adult functioning. World Health Organization 2025. This means that adolescent distress cannot be treated as a parent, as a private or isolated matter. It is closely tied to family relationships, school environment, available support, and broadening pattern of vulnerability and resilience. This article focuses especially on emotional deregulation. This idea has become more important in research on mental health for children and adolescents because it it addresses the challenges some young individual faces in recognizing, managing, and expressing their emotions appropriately. Police and others emotional regulation is described as concept that applies across different diagnoses, referring to difficulty in managing the intensity and nature of emotions. This is important because emotional degradation can be root cause of various notable challenges such as anger, outbursts, impulsive actions, ongoing sadness, anxiety, irritable social withdrawal, and unstable relationship with peers. An adolescent might not have official diagnosis, but they can still be dealing significantly with the emotional consequences of family issues in social work. This distinction is significant because it expands the focus beyond just diagnosis to include emotional functioning, coping abilities, and support from relationships. Examining emotional degradation and particularly vulnerable is in researching parental separation, as it clarifies how individuals experience and express their distress. Many teenagers
Okay,
react differently.
Merlin, thank you very much for stepping in. And thank you for what you already communicated to us from your group. I know you were not prepared for the leadership role of this group, but you only stepped in. So we want to thank you so much for doing that. I just discovered that you were not even attuned with your topic. Yeah, I don't know whether you are talking about digression or dysregulation. Which one are you talking about there? Which one is in your topic? Digression or dysregulation?
Is that
Eh?
dysregulation rather?
Dysregulation. Okay.
Dysregulation,
Okay,
dysregulation.
because
Just a
Please,
from
I don't
start.
know.
yes,
I
sir.
don't know. I'm sorry for that.
Okay, no problem. Ali, that had been taken and corrected. And then you seems not to be able to call psychosocial correctly. So can you repeat psychosocial?
Psychosocial.
So you were calling something
Thank you, sir.
else. All right. Thank you very
Psychosocial.
much.
I also
All right.
appreciate, sir. Thank you very much.
You're welcome. Okay, let's
Yes,
go to
sir.
the second presenter from the group. Can we have Akinwale Kehinde Olusegun here?
Yes, sir. I'm here, sir.
Okay, can you have the floor, please? Go ahead.
We part B, sir. We talk
Yeah,
about
section B.
a deep review of related literature. Parental separation as a psychosocial disruption. Parental separation is viewed in the article as a significant family change, and its impact on adolescents largely depends on specific circumstances involved. The research indicates that separation does not lead to the same result for all families. Recent evidence indicates that the emotional effects are frequently influenced by ongoing conflict after separation. Decreased parental availability, financial difficulties, changes in living situation, inadequate co-parenting and instability in daily care. In a significant study involving adolescents, Karina and colleagues, a study conducted in 2023 indicated that young individuals with separated parents experience more mental health issues compared to those from intact families. Additionally, the occurrence of negative life events was higher among the group with separated parents. This indicates that separation typically occurs within a broader context of psychosocial threat rather than as an isolated incident. Adolescent emotional dysregulation. Adolescent emotional dysregulation is discussed by
Can you go to
all
your
of
theories? Go to your theories and perspective, please.
okay, sir. The theory we have here, we have three theories. The first theory is attachment theory. Attachment theory, initially proposed by John Boyle in 1969, offers a significant explanation for the emotional effect of parental separation, both the research and attachment and loss emphasis the importance of emotional security in child development and suggest that the
Can
quality
you go
of
to your
attachment.
materials and method now? Go to your section
Okay.
C, materials and method.
Materials and methods. Section C, materials and methods. The article based on existing academic literature and relevant publication from institutions regarding possible separation, emotional dysregulation in adolescents, adolescent mental health, and psychosocial intervention. The review primarily depends on recent journal articles, literature review, and reliable reports that are directly connected to the article. Materials that are focused on adolescent family disruption, emotional outcome, and support measure relevant to the Nigerian context were prioritized. Method. The article used a descriptive review approach. Material relevant to the topic were collated by testing academic database and scholarly platform with keywords associated with parental separation, divorce, emotional dysregulation, adolescent mental health, and psychosocial intervention. The chosen material were thoroughly reviewed and organized based on the key topics identified in the story. The factors included family separation due to parental issues, emotional difficulties in teenagers, external stressors, protective elements, and psychological support strategies. The examining material was subsequently analyzed in a descriptive manner. Section D.
No, it's okay. It's okay. It's okay. You have to end with section C. We'll call on the last person in the group. Can we have Nwosu Ogechi to take the last part, which is section D, findings and recommendations? Ogechi.
Ogechi is there. Now, why is she not talking? Ogechi is there.
Ogechi. Okay. Maybe she left the phone somewhere and she's somewhere else. All right. Can we then have Marcus? Is Marcus there?
Yeah, Marcus is there.
Marcus, please go ahead.
Hello?
Please go ahead.
Okay, section D. Findings. Parental separation is constantly associated with low emotional well-being in adolescents. The examining research indicates that parental separation is linked to worse emotional and mental health outcomes during adolescence. Karina and colleagues, a study conducted in 2023 found that teenagers with separated parents experience more mental health issues compared to those from families that were not separated. This research is significant because it does not simplify the issue of just a forwarded before and after scenarios. It indicates that teenagers with divorced parents face more stressful life events, suggesting that the emotional impact of separation tends to increase over time due to ongoing challenges rather than being caused by a single event. The finding is important to the current article because it emphasizes that parental separation should be viewed as a psychosocial issue in social rather than just a private matter within family. The emotional challenges related to separation can be manifest as feelings of sadness, anger, irritability, insanity, withdrawal, anxiety, and inconsistent behavior. Adolescence is a time of significant development, and change in family structure can make it harder for individuals emotionally. Findings two, emotional the regulation is a key way to that distress is demonstrated.
Okay, I think your time is up. Thank you very much, Mr. Marcus, for that presentation. That is Group E's presentation. We've had a lot of challenge with Group E, and I wouldn't want that to happen with other groups. Please always be prepared. Each person in the group is expected to prepare for this presentation. You are not expected to hang presentation on some people in the group. Everybody participated and everybody should prepare. Please don't let us repeat what Group E has done. On that note, I want to call on Dr. Loretta Onyekwere to please give a review on the group's work rather. Thank you, ma. You have the floor, ma.
Thank you very much, Group E. Please adhere to the instruction of Dr. Tere. I mean other groups so that we won't have this delay. So I will start by saying that the study is relevant. It's equally timely. And I see it as a publishable paper if you take down a few corrections. You reviewed papers on WHO, and of course, WHO confirms that 1 in every 7 adolescents aged 10 to 19 experiences a mental disorder. In the area of depression, which you stated there, anxiety, behavioral disorders, and they are all the leading causes of adolescent illness and disability. So that has actually supported the importance of your topic. And then having gone through your work, I discovered that you did more of review. So I am suggesting for publication's sake that the work should bring in that aspect by reading parental separation and adolescent dysregulation in urban Nigeria, social work review, so that it will be sharp. Social work review of psychosocial risks, protective factors, and intervention pathways. This is a sharper and more publication-oriented because it clearly signals that the article is a review.
Thank you, ma. Please, ma.
All right.
I will gotten it, but I didn't get the last word. Protective factor and
Intervention pathways.
okay, thank you, ma.
Okay. So as I earlier said, the topic is socially relevant, and it is appropriate for social work because it has made a useful link between the parental separation and adolescent emotional functioning and psychosocial intervention. And then another commendation is that your theoretical anchors are suitable. You remember you use attachment,
Thank you, ma.
attachment, family, and all that is suitable. And then your recommendations are also practical and they are relevant to our school of social work, family counseling, and the rest of it. The area I will come up that you need to improve of wordness and wordness. In your abstract, you said you had a phrase like has become an important psychosocial concern. You have to be direct. It can be more direct. So rephrase that sentence there. Then under your methodology,
Okay, ma.
under your methodology, you wrote descriptive review approach, which is vague. Descriptive review approach is vague. Journals will prefer
Okay,
you to make it clearer. And
okay, ma.
like it should be descriptive literature review. Descriptive literature review. If you don't call it descriptive literature review, you can call it thematic review of recent studies, because that is what you actually did.
Okay, ma.
And then another important aspect that you need to improve is the area of time frame. We have not ended 2026. That is one. And then when I looked at your citation, you didn't have any reference that has to do with 2026. But your time frame stated that your work is 2020 to 2026, but your references
Okay,
do
ma.
not fully justify 2026. Your references do not fully justify 2020. So in that case, change it to 2020 to 2025.
Okay, ma. Noted, ma. Thank you.
Unless you have 2026 sources to add.
Okay, ma.
If you don't have, all you just need to do, based on the fact that 2026 has not even ended, and you do not have references justifying that, change it to 2020 to 2025.
Okay,
Am
ma.
I
Noted.
correct? Are you with me?
Yes, ma. Noted, ma.
And
Thank you, ma.
a minor issue is in the area of where you said the paper examined. Don't say it's better to put it, this review examines, not the paper. The work you did is a review. So it's a this review examined, and try as much as possible to avoid repetition of adolescents, because you repeated adolescents severally. They were too frequently repeated.
Okay, noted, ma. Thank you, ma.
You are noting it. Okay, beautiful. Then another thing in your literature review is where you said that articles, you use the word Paulus and others, Karina and others, Karina and colleagues, Rose and others. You don't publish papers in that format. You should replace them
Okay,
with
ma.
proper APA in-text citation. And the proper APA in-text citation says it should be Paulus et al. In bracket
So, yes,
2021.
sir.
Karina et al.
Okay, ma.
Bracket 2023. Rose et al. 2024. And not the way you stated it by saying Paulus and others. Karina and colleagues. Rose and others. Change it. Are you getting me?
Thank you, ma. Noted, ma. Yes,
All
ma.
right. Okay.
Noted, ma.
Your findings should be written.
Thank you so much, ma.
Okay. Your findings should be written in a more analytical tone. Your findings should be written in a more analytical tone. For example, instead of saying,
okay, ma.
The examined research indicates, instead of saying the examined research indicates, change it to the reviewed literature suggests. I'm interested in this because we are likely going to publish it in our journal, in our social work journal. So it will be good for it to read scholarly. Don't say the findings, the examined research indicates. Say the reviewed literature suggests. Okay. I've talked about the article citations where you say 2020. I've talked about that. Then,
yes, ma'am.
Your paper needs stronger Nigerian evidence.
Okay, ma'am.
Please search more. You will see your paper requires stronger Nigerian evidence because we are handling Nigerian situation. So there should be, more core evidence. What we have here is more core evidence in international, bringing Nigerian studies. Expand in that area of Nigerian studies, try to expand it, especially in our urban cities, Lagos, Ibadan, Port Harcourt, name them, Abuja, and in fact, any other urban settings. Then go to your methodology. Go to your methodology. The way you captioned your methodology is not okay for publication. Rather, if you check your methodology, you did not identify the search engines you use. Very important here because it's a review you did. So in methodology, it's good to bring them out, the search engines you use. So you can say that the study adopted a descriptive literature review design, whereby relevant literature was identified through searches of Google Scholar, through searches of PubMed, AGOL, ResearchGate. You have to state them. That's how your methodology to sound. You said the article adopted a descriptive literature review. Relevant literature was identified through searches of Google Scholar, PubMed, ResearchGate, institutional repositories, and official reports from WHO and UNICEF.
Okay, ma.
Do you understand what I'm saying? I'm not just saying okay. Are you understanding what I'm saying?
Ma, I'm writing down. I'm getting it, ma.
Okay.
I'm getting it, ma. Thank you, ma.
All right.
Yes,
then and then you now have to also state in your methodology that the review focused mainly on publications from 2020 to 2025.
Okay, ma.
Okay. Then there is the included materials were selected based on their relevance to adolescent development. These are the things that should be in your methodology, not all those other grammars we are speaking there. Some are okay, but you need to add these ones. You need to say that the selected literatures are organized thematically around parental separation, emotional dysregulation, mediating stressors, protective factors, theoretical explanations, and intervention implications. This are the things to be contained in your materials and method. Okay, so I will not say finally that this paper can be seen to be acceptable because the corrections are not major. Many of them are minor corrections. So you just need to input these things I have said so that the study can be strong, you know, and we can publish it in our social work journals. Thank you very much for the good work you did. Thank you. Over to you, Dr. Atere. I think I'm comfortable with this group. They did a good job. Thank you very much.
Thank you.
Dr. Atere, please.
All
Dr. Atere,
correction,
please.
we will
Yeah,
work
thank
on
you
it.
very much.
Dr. Atere, sir.
Yes, please.
Dr. Atere, you're here on the line, sir.
Okay. I've cited you. Thank you very much, sir. Welcome, sir.
Yes, I just want
Okay,
to appreciate the reviewer for the
okay.
necessary information she has added to the work. And we will also do the needful as soon as possible. Thank you very much, man, for that beautiful work. Thank you. We
Thank
appreciate
you
you. Dr.
very
Atere,
much.
thank you, sir.
Thank you. Okay, thank you very much, Dr. Loretta Onyekwere. We appreciate you as usual. You have always been known to give incisive touch on any paper handed to you to supervise or review. We thank you so much. I want to believe that. Riola, can you please mute your mic?
Later. I will call you later. I'm on a Zoom
Please
meeting.
mute your mic. Riola, mute your mic. Yusuf Idris, mute your mic. Mike Nasiru, mute your mic, please. Jimo Olufunke Louis, mute your mic. Okay, we want to continue from here. Let me briefly just acknowledge those who are our reviewers who are on this program. Now, I think Dr. Peter Adenibunyo just commented. Thank you very much for coming, Doc. We appreciate you. Dr. Peter Adenibunyo is from Neuropsychiatric Hospital, Yaba, Lagos.
Thank you very much, sir, for having me.
You're welcome, sir. We appreciate the presence of Dr. Adekalu Samuel. Is from Federal University, Oye Ekiti, and is on a trip. He just stopped at a bus stop now to take his paper. Dr. Adekalu, you are welcome.
All right, good morning, everyone, and good morning, my coordinator, Dr. Lawale Atere. I'm grateful to be in this platform. Good morning,
all right.
sir.
I also cite Dr. Vivian. Dr. Vivian, good morning. You're welcome.
Good morning, Dr. Atere. Good morning, everyone. It's always a pleasure to be here. Thank you.
Thank you, ma. Okay. Please, you just permit us to briefly take Dr. Adekalu, and the team is reviewing because he's at a park now waiting for his own turn so that he can move from that park to his destination. I think he's reviewing Group C. Group C, are you ready? Okay, is it okay or okay? Okay, Okpeyemi, are you there?
I'm there, sir. Good morning, everyone.
Good morning. Awe Oluwagboyega, are you there? Awe, are you there? Awe Elijah. Olatunji Samuel, are you there?
I am here, sir. Good morning, sir.
Good morning. Ayo Teva, are you there?
Yes, sir. Good morning, sir. Good morning, everyone.
All right. Again, Awe Elijah, are you there? Ajibade Oluwatosin, are you there? Ajibade Oluwatosin. Okeze Ijeoma, are you there? Okeze Ijeoma. Oyedokun Yinka, are you there? Person Tiye, are you there? Okay, we have 3 out of 8 participants here. I don't know. Earlier before now, I have been informed of the other 4 who did not cooperate with the group. That's Ajibade, Okeze, Oyedokun, and Person. So I assume we have 4 people who are together in this group who did justice to this paper. So we just briefly want to take that so that we can release Dr. Adekalu to continue on his journey. Thank you very much. Okay, Okpeyemi, can you please give a lead? You have the floor.
Thank you, sir.
Hello.
Once again, good morning, everyone. I am Okeyemi Selina, the group leader for Group C. Our topic is barriers to access and delivery of social welfare services in selected secondary health facilities in Lagos State. The topic talks about those barriers that the beneficiary, the barriers they experience in accessing the delivery of social welfare services in some selected secondary health facilities in Lagos State. Secondary health facility is a link between the primary and the tertiary facilities. So social welfare services, they are integral to holistic health care, particularly in health and secondary health facilities, where patients require both medical treatment and psychosocial or economic support intervention. What are these interventions? We have counseling, we have financial assistance, we have rehabilitation, we have referral, we have advocacy, and all this, they contribute to
We're not hearing you again.
Hello, sir. I think she's having a network issue.
Okay, I guess as much.
Can we take it up from her?
Okay.
Yeah, having said by thank you so much, sir. Having said by Mrs. Okpeyemi, the topic
Who
of
is
our
speaking, please? Who is speaking now?
My name is Olatunji Olayemi Samuel.
And that's how we said you should name your device. I'm only saying
wow. I thought it's already named. So sorry for that, sir.
Just go ahead so that I don't waste time.
Okay. Now, social services such as counseling, financial aid, like Operemi has said, they remain the essential and to ensure that individuals in families receive the support needed to cope with health, social and economic challenges in Lagos. Secondary health facilities such as facilities serves as a crucial link between primary care and tertiary, making them important to access points for vulnerable population. However, effective delivery of social welfare services within these facilities is often hindered by barriers which limits the people from accessing them. Barriers such as financial aid, publicity, advocacy, and the likes. These challenges reduce the quality and accessibility of responsiveness to care for people. And these services in selected secondary health facility in Lagos State, highlighting their implications for service outcome and opportunities for improvement. Today, we examine why these vital services remain out of reach for many in Lagos State Secondary Hospital despite their clear needs. Now, I will go straight to the statement of problem, the summary statement of problem here. Now, despite the essential role of social welfare services in supporting vulnerable individuals in healthcare system, many secondary health facilities in Lagos State struggle to provide these services effectively. Persistent barriers such as inadequate staffing, limited funding, poor infrastructure, weak referrals, and coordination system, and low publicity awareness continue to hinder timely access and quality of service delivery and reduce overall effectiveness of health and welfare intervention. The problem therefore lies in the gap between the growing demand of social welfare support and the limited capacity of secondary health facility. To deliver this,
thank you very much. So
yes,
let's
sir.
take somebody else that will take section B and C, literature review and materials and method. I mean, theories and materials and method, so that you can save time. Okay?
Okay, sir.
All right, thank you. Can we have Anyo Teva?
Yes, sir. Thank you so much. So in terms of
Anyo Teva, just take theories and methods.
okay. Thank you, sir. In terms of theoretical framework, the structural violence theory was used as a lens to review our findings from the literature review. And the structural violence theory explains how institutions and policies systematically harm vulnerable groups, such as those needing social welfare services in secondary health facilities. The structural violence theory was pioneered by Galtung in 1969 and expanded by Farmer in 2004. The theory conceptualizes how harm is inflicted through social structures, economic, political, legal, and cultural systems that systematically puts vulnerable groups in disadvantaged situations, producing avoidable suffering, deprivation, and even premature death. The theory reveals how power imbalance and systemic injustice, not just individual failures, lead to perpetuation of barriers for people needing social welfare services. Applied to Lagos State healthcare system, the structural violence theory explains how institutional arrangement deprive vulnerable populations of quality social services. For example, the absence of legal backing for social work practice, the chronic underfunding of social welfare systems or social work units in the hospitals, and the exclusion of health insurance schemes. All of these constitute structural deprivation and disproportionately harms the poor and those who are less able to afford healthcare services, such as persons with disabilities, but also persons with chronic illnesses requiring long-term care. There are also two other theories that support this, the ecological systems theory and the social systems theory as well. But however, we have used our structural violence theory as a primary theory. In terms of method, the methodology adopted in this paper was a DEX review of conceptual conceptual review methodology because it was designed to synthesize existing scholarly rather than generate primary data. This approach is appropriate for a seminar paper like this since it emphasizes literature review, course teams, and conceptual development over field work and statistical analysis. The review relied on recent academic sources published between 2001 and the latest year being 2025, sorry, from 2021 to 2025, including peer-reviewed journal articles, books, relevant policy documents on social work, healthcare delivery and barriers to social welfare services in Nigeria and similar contexts. The materials were identified through academic databases, institutional repositories, using keywords such as social welfare services, medical social work, access barrier, secondary health facilities, Lagos State, and hospital social work. Only literature that is generally relevant to the topic was included, and the non-academic and outdated sources were excluded. In terms of key findings, what exists and who can access them in terms of services, available services, we find that they are uneven and limited. Counseling services, referral services, discharge planning, advocacy, and financial support were unevenly distributed across secondary health facilities in Lagos. And then there were quite a number of accessibility barriers at patient level. For example, low awareness. We discovered that many patients don't know about the existing services where they exist. Poverty also, the lack of affordability of transport or other associated costs have also posed.
Okay, thank you, Mr. Anyo, for that beautiful rendition. We appreciate you. Let's go to the last person that will present in the group. Do we have Olatunji there? Is Olatunji present? Okay. Okay, do we have, okay, Aware has presented now?
Yes, I have presented Aware. Aware is not here.
Okay.
So I think it's just three of us.
It's
okay,
just
just
three
conclude.
of us.
Conclude with the last section.
Okay. So in terms of conclusion, barriers to social welfare services in Lagos secondary health facilities are multifaceted, ranging from institutional, professional, socioeconomic, and cultural barriers. The structural violence is at the core, systemically excluding vulnerable populations from essential psychosocial support. And without addressing these barriers, the goal of holistic, equitable healthcare in Lagos State will remain unachievable. This study also provides empirical evidence to guide policy and transform service delivery. We end with recommendations that the Lagos State should strengthen social welfare units in secondary health facilities by providing adequate funding, recruiting more medical social workers, and improving office infrastructure. The management of secondary health facilities should also ensure that social workers receive the resources and administrative support they need to perform their duties effectively. Management at health facilities in Lagos should also improve collaboration between social workers and other professionals by creating clear referral systems and including social workers in patient care planning. This will help to improve coordination and ensure that patients receive holistic care. The study also recommends regular training and capacity building programs for social workers to improve their professional skills and reduce the effect of heavy workloads. Such trainings should cover key aspects such as counseling, case management, disability inclusion, and other relevant areas of hospital social work practice. Public awareness campaigns should be carried out to educate patients and families about the availability and importance of the social welfare services in the health facilities. And finally, we also recommend that policymakers should formally recognize social work practice within the health system and strengthen support system for indigent patients through health insurance, partnerships with non-state actors, and other welfare interventions. Thank you.
All right, thank you very much for coming to the rescue of the group. We appreciate you for your apt interventions. Okay, let me just make the fact that in social work, we don't have patients. When I saw when OK started, she was mentioning patient, please Wherever you see patients in your work, change it to clients or service users.
Okay.
Those are the words that social work uses, not pay. It is medical doctors, nurses that use patients. We don't use that. We use clients or service user for those we work with. Thank you very much, Group C, for that. We will give the floor now to Dr. Adekalu, who is waiting at the park to take his own review. Doc, please, you have the floor.
Thank you very much, the moderator, Dr. Lawale Atere. I'm grateful for this opportunity. I want to also use this medium to thank our sitting professors in this platform and also to appreciate other academics and students here present. More importantly, I also want to tender an apology to one of my senior colleagues in the platform who has given me this privilege to quickly do my presentation in person of Associate Professor Alofe. Please, thank you very much, Ma. And let me go straight to the point, to the paper. Let me personally appreciate this group. I think Group C, you've done a very good job. And I must commend your efforts. And the last guy that anchored the presentation on behalf of the group have really do justice to the work. And I begin to wonder that I want to believe that the group of candidates that are in this group are those I may say they are currently in the field. They will understand what exactly is happening. All right, then I'm a bit worried at the beginning of the presentations because from the review I have with me here, I seems not to see the names and matric number or supervisors assigned to this work. So please, that's my first observation. I do expect to commend the supervisor assigned to this work for the good work they've guided you to do, because I've seen that the academic piece is a very sweet and very interesting, well-structured paper you've presented here. So I don't know who the assigned supervisor of this paper is, but I want to commend the effort of the persons.
Dr. Yokwere, River State University.
Okay, Dr. Yokwere, you have done a very good job by coordinating the student to come up with this interesting article paper to be published in C-ISOWN. And from the topic, I think this topic is good the way it has been structured, barrier to access and delivery of social welfare services in selected secondary health facilities in Lagos State. I think that using the word selected have already let us know what exactly you are looking into. So please, if you are submitting this paper thereafter, please, it's my observation that you include your names and matric numbers and the number of the supervisor. But to your abstract, I think the first 4 lines of your abstract I've reworked on your abstract and come up with a well comprehensive abstract for you. And you will see that when they pass this article to you. The first 4 lines, I think I've removed that and just go straight to the point. The studies examine the barriers to access and this and that. Of course, I require you to.
All right, thank you, sir.
All right, that's fine. And I've looking into that abstract again, and I've seen that if you are, I don't know who your target population is from what you have here in your abstract. From what I see, if I'm to figure out, I see that you are looking at medical social worker, and you have specified that here. And then, of course, you made your observations on a review. And I think if you take cognizance of the feedback from Dr. Recurrence that says just finished his own feedback, you can see that he made a lot of observations. And I begin to wonder if this group picked up their own areas of methodology from the previous group that presented their own work, because it looks similar. However, you did mention that your review of recent literature is within the space of 5 years, which is 2021 to 2026. And I can see that from your body work, I can see some articles that 1998 and the rest of them. I've asked, actually I've removed that, and I've been able to tailor your work to what is expected to look like. So part of what you seems to see as a challenge, you've mentioned a lack of legal and policy framework for social work practice. And last part of it, you do also mention what we call professional marginalization. So I must asking you a question: how do you arrive at this? Professional marginalization, I don't think that's existing among us yet. So I've really said that, oh, really, this statement look not true. So you may need to visit C-ISOWN platform and other relevant social work websites that are domiciled in Nigeria to really know that when it comes to policies and legal framework, there are some that are existing, though we may also have other areas that we also need to improve on. That may be specific to those that are in areas of medical social work. So I want you to be well guided in the use of words so that you can really know exactly what you are talking about. Now, background of your studies, I've looked at that, and I think from the beginning of this work to the end, I think the work is suitable. It's just that requires some technicality that you may need to also look into, because when you look at your abstract is a general summary of your work, which your reader will look into to guide whatever you are writing on your work. So when I look at some of your statements in your background of the studies, I was like, do you mention if this does not, please recap this in your abstract so that you can be on the same page with your reader when they are reading it. Interestingly, I can see that your first in-text citation in this work is 2026. And to your surprise, I did my personal search and I can see that you guys are on the right track, citing that Francis and Chinyan in 2026. I've read their work and I see that it's in line with the statement you make. And if you look at your background of study, I think our moderator have already corrected you on that. I've done that also here in my work, that in social work, we don't use patients, we use clients. So you work on that. And your work is majorly on social work service, which is good. Now, what are the challenges faced by medical social workers? So these should be your focus now. Since your target population is medical social workers, then the challenges faced by medical social workers should be your target, because I'll be waiting for you in your findings and also look at your areas of recommendations. So that is that on that. So I've referred to that on your work. Straight away, I move into your problem statement. I think it's well written and well updated references, and I think that is a bit okay at this level to come out with a statement and a gap that you are looking at. And I can see that most of your information is looking at filling the gap between the policymakers, administrators, and social workers. And of course, what interesting part in when you are wrapping up your problem statement, you are talking more on developing targeted interventions, which is what we really need so that our secondary health facilities, not only in Lagos State, but other states in Nigeria, can also have a very interesting. Then I move to your objective. You wrote about 4 objectives. I've synchronized that to 2 objectives for you. I've asked you to remove your first objective and remove your third objective. When you look at the topic you are talking about, you can easily see that your second objective and your fourth objective is the one speaking directly to your work. So I've worked on that for you to stick with objective 2 and 4, and I've already recapped that for you guys in your research question. So I guess that is in line. So when it comes to your literature review, if you check your line 4, you also mentioned about a relay 2011. I said this is not stay close to your answer. You said you review literature between 2021 to 2026. So I don't know what 2011 is looking for. Of course, you have a very relevant instant internalization there. You have a decade tour in 2025 and 2023. Those are suitable for you. And I can see that your first objective when you are looking at type of intervention with regards to your topic, and your next line is talking about types of social services. I think you can recap this in your literature, okay, or your background of study and explain it to us so that you won't have much objective. This is just a kind of a paper, an article paper. An article paper can be limited to 2 or 1 objective, depending on the nature of your work. So you can maybe recap this type of social welfare services you've identified yet, and of course, bring it in your background of studies. That is okay for that institute. Now you move, I think you've been able to identify some of these challenges are fine. And I can see this is correct. When you quoted Adewale, Adebowale, and Ogunbode 2022 are cited in this. So these are very good. I think this could have done a very interesting work. Not too much on the, even on the technicality of this work. I think you guys have done a good job. Now, am I a bit worried about? Yes, I've removed that for you. Of course, I see you explaining your first presenter. I think the guy that took over from the lady explaining social system theory and the rest. I think you guys give a very strong background of what that theory stands for and how you link this theory to your work, which is okay. Now, my worry is your findings. I've been able to, I don't know, I'm going to, your finding is just about 8 lines or 9 lines. I say, go back to your work abstract and recap it. Explain how you arrive at this finding, because I didn't see anything findings here. That's my worry. I didn't see anything findings here. And I think the challenge here is that when you look at how you link up from your type of social welfare interventions and identifying those institutional support stuff, I think you can recap that and to link it up with what you're finding and saying. But I heard you during your presentation that you approached some social workers in the Lagos State, this and that. But I didn't see any presentation of results here. You can't just present 4 lines or 5 lines of present. I mean, this does not even speak of findings. So because you may not understand that you involve social workers, medical social workers in Lagos State and the rest of them. So I'm not really clear. Okay, and I'm a bit worried. Even your methodology, I see that you say you use Dex review and all manner of methodology. Your paper is just more like a conceptual paper. You're just reviewing the existing work that people have done in this area and trying to fill the gap with the current situations in Lagos State. That's what you intend to do. So I don't see even your methodology, what you intend to do. Maybe you are using a qualitative research or quantitative research to get your data. But I see that during your presentation, you said your findings is how you people arrived at this. Please, if truly you have that findings, I think I want you to revisit your findings and recap what you have in your findings so that you can have a very strong paper to be published in our institute. Okay? And you move straight to your recommendation. I was wondering, no conclusion. If yes, then I don't think this is an issue in Lagos State. I don't think so. So you may need to also give a good conclusion. And of course, from your findings, and that is the challenge you have. I can see that you guys did not have a sufficient findings and you have it very difficult to make recommendations. So please talk more about your findings. I've put it here so that can guide your reader to know what exactly your findings are and what recommendations you are making. And from your references, I think you guys have followed the APA style of references, which is fine for me. I think that's my little observations on this paper. You get my feedback from our moderator. Look at those feedback and please do the needful and come out with a very solid paper.
Okay,
all right,
sir.
that's all.
Thank you so much, sir.
Thank you so much, sir.
Okay, thank you very much, Dr. Samuel Adekalu, for that beautiful review of Group 6 paper. We appreciate you as usual. You have always been very, very focused and direct in your ways of review. We appreciate you. I believe that the group have heard you, will send the paper back to you so that you can take to the correction, work with your supervisors, and then also sending the paper after all correction have been done to the publisher of the journal that we talked about. All right, thank you very much, Group C, for the beautiful work that have been done, and thank you for the review we made on the paper. We expect that as soon as possible, we'll receive back. You receive back your corrections. Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you so much, sir.
All right, we go to the next group. We have in the house one of our newest professor, Professor Ebenezer Levi, who has just been promoted to the rank of professor at Ignatius Ajuru University of Education, Port Harcourt, Rivers State.
Congratulations.
Can we unmute and say congratulations to him and give him a round of applause?
Congratulations, sir.
Congratulations, sir.
Thank you, moderator. Thank you, presenter. Thank you. And here with us. Thank you. I appreciate it.
Thank you, sir. We just have not to delay you. We'll just go to your group, the group we are reviewing, that's group B. We have 6 candidates in group B, and then we'll be, okay, Loretta Kemi is the group lead. Are you there, Loretta?
Yes, sir. Yes, sir.
All right. Loretta has been very, very diligent and always troubling me. A very apt and no, she's been very consistent and a dutiful leader. Thank you for coordinating that group. We appreciate
Thank
you.
you, sir.
All right. Is Oreoluwa Abimbola Sherifat there?
Yes, sir. Yes, sir.
Okay,
Good afternoon,
Yusuf
sir.
Okpeyemi, are you there?
Yes, sir. I'm here.
Adejumo Oluwatoyin, are you there?
I'm here, sir.
Jegede Olumide, are you there?
I'm here, sir.
All right. Oguniyi Stephen, are you there? Oguniyi, are you there? Okay, seems Oguniyi is not here. Okay. So 1 down. Okay. I believe Dr. Levi is ready for us. So let's give the floor to Loretta to kickstart the group.
Good afternoon, everybody. My name is Loretta Kemia. I'm representing Group B, and our topic is social workers' role in overcoming barriers to accessing quality medical care, a case study of Ondo State, Nigeria. Access to quality medical care is central to human welfare, public health, and social justice. Across health systems, access is not only about the physical presence of hospitals and clinics, but about whether people can obtain timely, accessible, affordable, and effective care when they need it. Globally, countries with stronger public financing systems and wider insurance coverage tend to reduce direct household spending and improve continuity of care. In many low and middle income settings, however, healthcare access remains strongly shaped by poverty, weak infrastructure, and institutional inequalities. In Nigeria, the healthcare system is organized into primary, secondary, and tertiary level, delivered by both public and private providers. On paper, this structure should support broad population access. In practice, access remains uneven. Public facilities are often under-resourced, while private services are frequently beyond the financial reach of low-income households. Recent World Bank data sourced from the WHO Global Health Expenditure Database showed that out-of-pocket expenditures still constitute a large a very large share of current health expenditure in Nigeria, illustrating the extent to which households continue to finance care directly. World Health Organization 2024. The consequences of poor access are visible in avoidable illness, delayed treatment, and poor maternal and child care outcome. WHO reported in late 2024 that comprehensive hospital data from all states in Nigeria provided new insight into patterns of maternal and newborn mortality and modality, reinforcing the scale of quality of care and access challenges within the country. UNICEF 2024 situation analysis also highlighted that many Nigerian children continue to experience income poverty and limited access to health care and other essential services. World Bank 2025. The issue is especially important from a social work perspective because healthcare access is shaped by social conditions such as income, education, transport, family structure, stigma, disability, and exclusion. Social workers operating in healthcare settings help individuals and families understand their care options, navigate institutional processes, cope with psychosocial stress, and connect with support systems. Their role becomes more important where health system is difficult to access and where vulnerable populations are at risk of being left behind. Ondo State provides a useful context for such a study. The state has both urban and rural communities, public and private facilities, and ongoing efforts to improve primary health care. In August 2024, the Ondo State government announced plans with World Bank support to build primary health care facilities across 203 wards, reflecting both a recognition of service gap and an effort to strengthen access at community level. Ondo State Government 2024. The study therefore examined barriers of accessing quality medical care in Ondo State, Nigeria from a social work perspective. Despite the existence of health facilities and policy efforts aimed at universal health coverage, many Nigerians still experience serious difficulty in obtaining quality medical care. The challenge is not simply whether hospitals exist, but whether individuals can afford care. Physically reached facilities, trust the services available, and receive timely and respectful treatment when they arrive. In Nigeria, financial barriers remain particularly severe. The NHIA has repeatedly framed its current reframe around reforms.
Okay, Loretta, thank you very much for your rendition. Let's pick somebody else to do section B and C from your group. Okay.
Okay, sir.
Can we have Yusuf Idris there?
Yes, sir.
Okay, section B and C, very briefly, in 5 minutes.
Okay, sir. A minute.
Just go straight to your theory and then your methods. Leave literature.
Okay, thank you, sir. Sorry, a minute, sir. I want to be on the same page. Thank you, sir.
Okay.
From my colleagues are taught, so we have two theories. Theory social determinants of health theory and theory. We have social determinants of health theories. This theory explains outcomes are shaped by social and economic conditions, including poverty, education, employment, housing, transport, and social support. It is relevant to this study because residents' health decisions in Ondo State are influenced by this wider phenomena, not only therefore, and also the social theorists, that's the second theory, speak about the views of healthcare access as the product of interacting parts, the patient, family, and facility, transport system, welfare support, governance structure, and community norms. The theory is useful because healthcare access barriers are rarely isolated. They are often accumulated. Therefore, what is it called? The barriers to accessing quality healthcare in Nigeria. We have barriers, economic barriers, geographic barriers, social cultural barriers, psychological barriers. Here we have is financial hardship is one of the strongest barriers to healthcare access in Nigeria. That is out of pocket payment household to catastrophic expenditure and delayed care. Through regional shown that direct household spending remains a dominant financing across many African countries. And World Bank's Nigerian data confirm that this remains a significant issue nationally, according to NHIA, that is National Health Insurance Authority, has also acknowledged the poverty effect of healthcare spending. Geographic barriers. Geographic barriers, that is, rural communities frequently face long distance to facilities, weak emergency referral system, and transport difficulties. Quality work from rural Nigeria are repeatedly shown that distance and transport problems shape whether formal care is used at all. Also, we talk about the institutional barrier. Institutional barriers include inadequate staffing, long waiting time, stock out, weak referral system, and poor provider attitudes, according to World Health Organization's 2024. Maternal and newborn report for Nigeria emphasize the value of better guide improving quality and outcomes. Reflecting how service delivery challenges continue to matter. Then we move to cultural barriers. Cultural barrier, that is cultural beliefs, religious structures, religious structures, and household power relations influence when and where people seek treatment. Recent qualitative evidence that cultural and religious structures can either enable or limit women's use of maternal health services. And lastly, we talk about the psychological barriers, that is fear of hospitals, fear of diagnosis, stigma, and distrust in the health system can yes, these barriers are visible in mental health, HIV-related care, reproductive health, and other.
Okay, Yusuf, thank you very much. Even though you've not given us what the methodology is like, and we just believe that will be found in your work that will be reviewed. Okay, thank you very much. Can we have Jegede Olumide to take the last part D, findings and recommendation? Is Olumide there? Jagede is not there. Okay.
Oh, I'm here, sir. Jagade Adebola Olamide, sir, not Olumide.
Okay, please conclude.
Okay, sir. The presentation of findings we segmented by teams. And in team 1, we looked at financial hardship and out-of-pocket payments. And we discovered that the strongest theme that emerged from this interview was the cost of healthcare. Participants repeatedly described healthcare expenses as a major factor delaying care seeking. So social workers and health workers noted that many patients arrive late because they first try to look for something cheap, like alternatives that we cater for their care, such as self-medication, going to all these patient shops to buy drugs, and also herbs and unbelievably prayer centers. So from our interview, a social worker stated that the biggest challenge for most patients is money. Even when they want to come early, they cannot afford consultation, drugs, texts, transport at the same time. Then we also interview a client. A client explains that sometimes you are told to do tests and buy drugs, but the money is too much. That is why some people go home and come back later when the sickness is worse. So these responses align with the national evidence showing that direct household spending remains a major feature of health financing in Nigeria and continues to expose households to financial distress. Now let's go to team 4. In team 4, we worked on inadequate staffing, waiting time, and service delay. Institutional barriers featured strongly in the interview. Participants described overcrowding, staff shortages, long waiting times, and delays in assessing tests or seeing clinicians. So these experiences affected trust in public healthcare facilities and sometimes push people towards private and informal care. So we approached a client who said you can stay for hours before seeing anybody, especially in public hospitals. Some people get discouraged and leave at the end of the day. But a nurse said the workload is high and there are times the staff available are not enough for the number of clients, which we usually experience in our hospitals. So a social worker noted that when patients already come with financial stress and then face delay and poor attention, it affects their confidence in the hospital. Now let's move to team 7, talking about cultural and religious beliefs. Participants reported that cultural beliefs, reliance on traditional medicine, and faith-based interpretation of illness influence care choices. In some cases, hospital care was delayed because families first sought help from prayer houses or herbalists. So one social worker said that some patients come only after trying herbs or spiritual homes first. By that, the situation may have become more difficult to manage. And a client said in some families, they believe strongly in herbal treatments before going to hospital. So the findings aligns with the Nigerian research showing that cultural and religious structures can shape shape the use of formal healthcare. Now let's go to discussion of findings. The study found that barriers to quality medical care in Ondo State were multidimensional and interrelated. Financial hardship emerged as the most prominent barrier, and especially where households had to finance care directly. So this is consistent with current expenditure data showing that out-of-pocket payments remains a major component of health financing in Nigeria. So institutional barriers such as waiting time, insufficient staffing, weak patients experience were also central. These findings are consistent with wider concerns about quality and responsiveness in Nigeria health facilities, including WHO's recent use of national hospital data to highlight patterns in maternal and newborn outcomes. So in summary, the summary of findings, this study examined barriers to accessing quality medical care.
Give us your recommendations, please. Your time is already up.
Okay, sir. In our recommendation, based on our findings, the study recommend the following. Government should strengthen financial protection for health. There is a need to broaden our practical insurance coverage for poor and vulnerable households and reduce direct payments at point of care. Transportation and referral support should also be improved. Emergency and routine access become weaker. Distance and poor roads delay treatment. Also, we recommended that community health education should be expanded. Like awareness campaign should focus on early care seeking, health literacy, and risk of treatment delay. Then we also said that hospital social work units should be better integrated into care planning. This will improve a lot of discharge coordination, family support, and assistance for vulnerable patients. But we found, we discovered some limitations. Hold on, sir, please. So we discovered some limitations. The study was limited by its qualitative scope and relatively small sample size. It was also restricted to Ondo State, no doubt. So the findings cannot be statistically generalized to the whole of Nigeria. In addition, because experiences of access differ across facility type and location. So some perspectives may not have been fully captured in this work. Suggestion for further research.
It's okay. It's okay. Your time is up. You spent extra 2 minutes. All right. I think we are okay with that. Thank you very much. The group lead, thank you for the other supporting presenter. We appreciate you. Okay, let's give the floor to Professor Ebenezer Levi from Ignatius Ajuru University of Education. Thank you, sir.
Thank you, moderator. Dr. Tere, I appreciate the privilege of being with you on this very important program. I also must commend the presenters, for their attendance. It's one of those groups that you have almost all the presenters being in attendance. I must appreciate them for that. I also must appreciate them for the timely topic presented on this very important floor for discussion. It's a very important one because for us to go forward as social workers, we need to review, take a look at our barriers. There actually are barriers that have hindered the practice of social work over time. And these we can do when we have a time like this and have a way forward to overcome these very important barriers. Yeah, listening very carefully to the presenter indicates that they own their work and speak to the paper they are presenting. It's really commendable on the part of our presenters. I must also point out to the first presenter who actually didn't do so much to that really. But my very important concern has to do with the theory, that is studied measure. That's really good. But one would have expected that not much as there's nothing wrong to use two theories, but it is required that they should have been able to present the pitfall of the first theory that necessitated the second theory. We don't see the pitfall of the first theory. On which ground do we now, opt to use, the second? second theories, because theories, and why the two theories now become so necessary for us also. Of course, with that, it means that the group is taking this position, that even based on these defects of this first theory, and of course, even of the second part, because we have synchronized the both of them, it means the defects of the two theories, has been taken, over, and so we can adopt these two theories. I think that's really need to be put across to us. It is important also to draw the attention of the
I think we lost your audio, Prof.
Sorry, sir. I think we are not hearing, sir.
Prof, we lost your audio. Hello, Prof, can you hear us? Hello, Prof. Okay, he's back.
Can you help us recap the sir? We can't hear you then.
Hello, Prof. Hello, sir. I think he's been shut out by the network.
Probably we should call him to know whether he's still on or not, sir.
Yeah, I will.
Probably you can just reach out to him to know.
Second network is very bad.
Are you in Port Harcourt?
Yes, I am.
Okay.
Madam Loretta, are you taking note of the correction so that we can do?
I thought you would help me out in that aspect. Let me rest a little.
It's me, Abimbola. Hey.
Oh, my sweetheart, my sister, my darling. Please take note. Sweetheart. Please take note. I'm tired. I didn't sleep well yesterday. I had other things to do, please. But I'm taking my own notes anyway. But someone else should take so that we can put them together.
Okay.
Thank you.
Okay, I think he's back, please.
Welcome, sir. Help us to recap because the network did not allow us to get.
Hello, Prof. I thought he was back. I just called him now and he said he was back. Hello? I can't see him on the participant list.
Prof is not on the platform.
Yes. Okay. Maybe. Okay, I think what we'll do is to step down this group for now. If he comes back, we may likely take him, and if not, we will send the review back to the group. The network is so erratic from his end. All right. Okay, let's just move on so that we'll save our time. Let's go quickly back to.
So Teresa, I don't know if I can make some suggestions.
Okay. What actually is this? Hello. Hello, Dr. Peter. Network again. Okay. I want us to just go ahead. Whenever Prof comes back, he will take his concluding part after he must have finished the next
Hello.
presentation. Yes,
Hello,
please.
sir.
Yes, please.
The network is very bad.
Yes, yes. I can see. All right. Let's go to Group A. We'll go to Group A. Associate Professor Vivian Alofe is also supposed to be somewhere, and he has been with us since we started. So we need to release her. Please, let's just briefly take our own turn. She's reviewing Group A.
Okay, I'm present.
Hello, who is speaking? Okay, Prof. Okay, you're back.
Yeah, sorry.
Okay, try conclude, sir.
Yeah, I think, I don't know, there's a very serious break here, but just to put it across that I think I need to have the work so that I can do other technicalities that has to do with the work and forward it to you. I think so.
It's okay, sir.
Yeah.
It's all right, sir. All right, yeah.
Thank you, sir.
Yeah.
Okay, Group B. That's all for now. So, Dr.
Hello, sir. Hello, doctor. He only
Yes,
called 3 of us. He didn't call me and me. I hope nothing, sir.
No, it's 3. We will just at random pick 2.
Oh, okay. Okay.
And we have done that. Yeah, thank you.
No problem. I just want to confirm so that.
Oh, okay.
Okay. Thank you,
problem.
sir.
Thank you very much, Group B, for good work done. All right, Group A. Is Ibuzo Alma there?
Yes, I am.
Okay. Do we have
Ibuzo, yes, I am.
Ibuzo is there. That's the group lead. Okay. Do we have Udi Princess?
Yes, I'm present.
Okay. Okay. Ubajekwe is on the hospital bed. We pray for quick recovery for her.
Amen.
Olagoke Dare, are you there? Olagoke Dare.
Dare was on the call. I think it's network.
Okay. Okay, I can see her. Dr. Dare Olagoke. Okay, she's here. She's even using two networks, and the two are not.
Yes, sir. I'm here, sir.
You are there. Okay, good.
Yes, sir.
All right. Do we have Olugbemiga Aduola there?
Yes, I'm here, sir.
All right. Do we have Rita Akinola? Rita Akinola, are you there? No. Okay, we have 5
I think
in
she
the
had
house.
network issue.
Okay. I think I saw her when we started somehow. Okay. All right, let's start. Group A, you have the floor. Dr. Vivian, are you with us? Dr. Vivian. Hello, Dr. Vivian.
I can see her. She's online.
Hello, Dr. Vivian. Are you with us? Let me just tap her.
You make another person host in case of network, so that all of us will not got at the same.
Chinwe Ibuzo. Akanbi, let everybody,
Yes,
every other
sir.
person meet their mic. Okay. Okay. Ibuzo.
Yes, sir.
Yeah.
Okay, I think Dr. Vivian is trying to respond.
It's another good sword. Can you bring that topic? Okay. I will.
There's another one. Easy. That the first. That one.
Hello, Ibuzo. You have the floor, please.
Yes, sir. Okay, sir. Good afternoon to our reviewer and good afternoon to everybody. Our topic is child welfare services in high conflict marriages and divorce. So as an introduction, we brought in the fact that child welfare is actually very important. Sorry, I'm getting interrupted. Excuse me, sir.
Just continue. We are hearing.
Okay.
Okay,
so as an introduction, we brought in the fact that child welfare is of very importance, it's of good importance, and it is very important in building the society because the children are the leaders of tomorrow.
Yeah.
Because the children are the leaders of tomorrow. And sorry, hello, sir.
Yeah, for the first time.
Yes. Can we put
sir.
you on hold for
Continue.
now? Hello, Group A. Ibuzo.
Okay, sir.
Please hold on, please. Let me finish concluding with your reviewer.
Okay, sir. Okay, sir.
Okay, she has asked that we delay us to the end. Even though she's listening to you, but a bit distracted where she is now.
Okay, sir.
Okay, so please let's give her time to put herself together and then she will come back. Okay, thank you very much. Let's take Dr. Peter. Are you there?
I'm here, sir.
Okay, let's take your group F.
Okay, sir.
All right. Do we have Adeoti there? Group F, Adeoti, the group lead. Are you there?
I'm here, sir.
Morning, all right. Thank you for being here. Good afternoon. Okay, do we have Aram Eberechi here? Aram Eberechi, are you present? Yusuf Raji Babatude, are you there?
I'm present.
Agbaoye Olumayowa, are you there? Agbaoye Olumayowa. Okay, he's not here. Do you have Ukon Sonate? Ukon Sonate. Are you there? Lawal Oyeyemi, are you there?
I'm here, sir.
All right. Okafo Mary Pascaline, are you there?
I am here, sir.
Hey,
all right. Ukonsonate, are you there? All right. Okay. So this is Group F to be reviewed by Dr. Peter Adenibunyo. Dr. Peter Adenibunyo is from Neuropsychiatric Hospital, Yaba, the one we call Yaba Left. All right, sir. You have the floor, Adeoti, for your review, introduction.
Sir, it is not Adeoti that we take the introductory part. It is Yusuf that we take the introductory part, sir.
Who?
Yusuf, sir.
Yusuf?
Yes, sir.
Is Yusuf the group lead?
Yes. Adeoti was just interfacing with regards to other resources. You know, we started.
Okay.
And
So
we had
Yusuf
to
is the
split
group lead?
Yes, sir. Yusuf is our group leader.
Okay. No problem.
Hey,
Please go
sir.
ahead. Good morning.
Thank you very much, sir. Good morning, sir. My name is Yusuf Raji Babatunde, and I'm representing Group F. And the topic before us today is perception of internet fraud among undergraduates in University of Lagos, implication for social work practice. And I will be taking the introductory part because I want to because we are limited in number, we've actually divided it amongst
Just go ahead. No explanation. Just go ahead.
Okay, sir. So the topic set out today was to examine the perception of internet fraud among undergraduate students of the University of Lagos and its implication for social work practice in Nigeria. A qualitative research design was adopted, and data were collected through semi-structured in-depth interview with 12 students selected using purposive and snowball sampling techniques. The data were analyzed using thematic analysis. Findings from the set-out topic reveal that internet fraud is widely perceived as common and increasingly normalized among students and youth within the context with which we are speaking, with some being it as a normal survival strategy. Key indicators expressing these perceptions include economic hardship, peer influence, and social media exposure. The study also found out that continuous exposure to such practices has weakened moral boundaries, making internet fraud more socially acceptable within certain peers. The study also concludes that social work interventions are essential in addressing both behavioral and structural factors contributing to the trend. It recommends value reorientation, counseling, awareness campaign, youth empowerment initiative, entrepreneurship to reduce normalization of internet fraud among stakeholders. As a means of introduction, internet fraud refers to the criminal activities conducted through online platforms where offenders manipulate victims through deception, such as impersonation, phishing, romance scam, account promise, fake internet, and investment scheme. Internet fraud is a major global concern. It's a global major problem and a social phenomenon confronting most of the country, and Nigeria is not exempted. And it involves the use of internet, such as through the use of email, websites, chat rooms, message boards, to deceive victims through false information and through concealment of facts in order to obtain money, property, inheritance, or properties illegally. It is a form of cybercrime that involves fraudulent online transactions and solicitations. In Nigeria, it is rapidly increasing and is often driven by individuals seeking an unearned luxurious lifestyle through criminal means. That was done by Ogbonna in 2023, sir. Nigeria is also experiencing serious challenges from cybercrime, financial crime, and internet fraud, which harm its economic and international reputation. In 2022 alone, the country lost an estimated 500 million to cybercrime, and between 2017 and 2023, losses reached over 1.1 trillion across all sectors, including banking, telecommunication, government, and other major major public and private sectors. The problem has continued to worsen into 2025, 2026, 2024, 2025, and 2026 to be precise, due to more advanced technology in cyber attack and increasing use of cryptocurrency for money laundering. You know, cryptocurrency is very difficult to actually have access to in terms of tracing laundered funds. The rising involvement of youths in internet fraud in Nigeria, commonly referred to as Yahoo Yahoo, is largely driven by high levels of unemployment and is further worsened by corruption among public, political, and even private sectors officials, making it a significant contributing factor. This was submitted by Ebuibi and Oguruga in 2023. The social work has made a significant contribution to addressing youth involvement in crime. The application of social work intervention strategy is essential through guidance and counseling, mentorship, awareness campaign, advocacy, entrepreneurship models, skills acquisition program. These efforts, when carried out collaboratively by community leaders, government agency, non-governmental organization, and other strategic stakeholders, can reduce rates and use the percentage of youth crime in society, and that was done by Albert and Okuru in 2025. The above present a snapshot of existing studies on internet fraud in Nigeria. However, the perception of internet fraud among undergraduate students at the University of Lagos has not yet been sufficiently explored, particularly with study which to examine of to examine the perception of internet among undergraduates of the University of Lagos and its implication for social work practice. To examine question one, to examine the perception of internet fraud among student perception of internet fraud, to assess the implications of this perception for social work practice. Research question. The study will be guided by the following research questions. How do undergraduate students of the University of Lagos perceive internet fraud? What factors influence students? Yes, sir.
You've shot 1 minute above, I mean beyond your time. All right, thank you very much for the beautiful introduction given already. We appreciate you.
Thank you, sir.
Can we have Adeoti taking section B and C?
Thank you, sir.
Okay. Thank you, sir.
All right. Just your theories and your methodology.
Okay. We have the good morning. Good morning, Sasamas.
Just go
the
ahead,
theories
please.
Okay, thank you, sir. We have the theories as well as the models into this study. And we have the social learning theory by Bandura 1977 and the social learning theory propounded by this same Herbert Bandura in 1997 explains that behavior the behavior is learned through observation, imitation, and reinforcement within social environment. However, students may develop favorable perception of internet fraud when they observe their peers or influencers who appear to have gained wealth and status from such activities. So that is the social learning theory by Bandura. And we also have the sociological perspective of defiance. This explains that different behaviors has been shaped by social structures, cultural values, and environmental conditions rather than individual traits. So this internet fraud among the youth is basically linked to factors such as unemployment, socioeconomic. Hello?
Please go ahead. That's how I say, everybody, please mute your mics. Akobi, mute your mic. Akim, mute your mic. Adeoti. Okay, Adeoti is speaking. Yusuf, mute your mic, please. You are disturbing us, you are interfering.
Okay. Thank you. So the internet fraud among the youth, especially the undergraduate students, of the University of Lagos, basically going by the sociological perspective of defense, that the socio-economic inequality, prayer for wealth, the rat race for wealth and materialism, and the normalization of quick money culture occasioned this behavior, so to speak. Then the materials, the methodology now. We have the research design, which is the qualitative. We have the study area as the University of Lagos. We have the population target as the university undergraduate students, and the sample size, a few number of students, while the sampling technique is the purposive sampling and snowball sampling techniques. Then the method of data collection. It was conducted via WhatsApp video calls and Google Meet. Then each interview lasted between 20 and 30 minutes, whereby participants gave their informed consent and were assured of their confidentiality. However, during the interview, the audios were recorded and it was supplemented with the feed notes. Thank you, sir.
Oh, sorry, I didn't know I was, sorry, I didn't know I was muted. So sorry, please. Okay, can we have Aram Eberechi? Is Aram there? Is Agbaye there? What about Lawal? Oh, you hear me? Time for this group.
Sir, please, we only three that did the work. Can I continue from where he stopped?
Who is speaking?
It's okay for Chinemelum, sir.
Nweke.
Chinemelum Okafor. Mary Pascaline.
But I've called you now.
No, I didn't hear you call me.
I called you, you didn't answer. Okay,
Sorry,
please go
sir, I
ahead.
didn't hear that. Okay.
Go ahead, please.
Okay. Thank you, sir. Good morning, everyone. Continuing from where he stopped, we analyzed, we used the thematic analysis to analyze
We
our
are going
data.
to the last now.
Okay, findings.
Please find this and recommendation, please.
Okay, findings and recommendation. After analyzing using the thematic analysis, we have few findings. We found out that the perception of internet fraud among undergraduate students indicates that internet fraud is widely perceived among undergraduates of University of Lagos as common, visible, and increasingly normalized within the campus environment. One of the respondents also quotes this that students see it as a business idea or a form of compensation. Then secondly, factors influencing, we also found the factors influencing students' perception of internet fraud, such as the economic factor, the social, the psychological, structural factors. Some of the examples: economic hardship. Some students explain that economic hardship are reasons why people go into this internet fraud. They also explain that peer influence. One of the students quoted that when they see their other students going into internet fraud and making money from it and living a certain lifestyle, students are most likely to be influenced to join internet fraud and continue so as to make the kind of money their peers are making or to live the kind of lifestyle their peers are living. We also found out that social media is a huge factor in influencing this internet fraud among university undergraduate students, such as we all know that recently internet is vast, everybody's using social media, and they explain that when they go online and they see influencers posting the kind of money they make, and those involved in internet fraud no longer hide their wealth, but rather they publicize it. You see it on everywhere like TikTok, Instagram. So these things actually make them want to go into the internet fraud to also join in and do what the rest are doing, and also be able to make the kind of money everybody's making. That it now normalize social media now normalizes internet fraud in a way that it makes students feel like it's a normal thing and they can go into it and continue. And also, we found out that the sense of materialism and desire for quick wealth. So students also said that people, that their peers no longer want to work hard to make money. They no longer want to take the process of making money, going through the gradual process of making money. Rather, they want to make the money immediately. So that influences them to go into internet fraud. So instead of working hard and taking time, the steps and process of making money, rather they want to make it immediately. Also, its implication to social work. We also found some implications to social work practice. It particularly in addressing both behavioral and structural dimension of internet fraud among students. The normalization of internet fraud underscores the value and underscores for value reorientation and continuous sensitization. We found that it is necessary for social workers to continually reorient undergraduate students and continually sensitize them on the dangers of internet fraud, and switching their mentality from seeing it as a common thing and as a normal thing to seeing it as a social problem and seeing it as a crime. Instead of going into it, rather they will see it as a crime. Also, it influences the psychological and peer related factor that highlights the importance of counseling and psychosocial support. Here he's saying that social workers need to go into schools, be there in university, be able to counsel students. Hello? Is someone speaking? Please, can I continue?
Please continue. I tire for all these people that are disturbing us. Mute your mic. If you not mute your mic, what is it now?
Okay, let me continue.
Please continue. Thank you.
Okay, sir. Thank you, sir. That there is importance for counseling and psychosocial support in the sense of it's important to go into those peer groups that have already normalized the fact that internet internet fraud is a normal. It's important to counsel them, provide psychosocial support to both those that are already participating in this and those that are already watching their influence, are about to go into it. It's good to reorient their mentality, counsel them on the importance to rather go through a proper means of acquiring wealth instead of going through the shortcut of going into internet fraud. Then it's also important to respondents also said it is important for social structure engagement with suggestion that social workers should collaborate with government to improve opportunities in the sense of improving social worker working at the macro level to improve opportunities for undergraduate students. If there are improvement of opportunities, there are job opportunities out there, there are other means of legal means of making money for undergraduate students, they will not see the reason to go into internet fraud. Rather, they will go through the legal means, knowing the fact that some students actually supported themselves in school. But if they can figure out a legal means, or if social workers and government can figure out a legal means of them making money, it will make them not to go into the internet fraud. Rather, they will go through the legal routes. Recommendations. So we have a few recommendations, but I'll just highlight 2 or 3. Social work intervention should incorporate early preventive education, particularly during student orientation and transition programs. So we also, through our research, we also saw that some students coming in, like new students, like first year, they also get to learn this thing from other levels. So if during their student orientation, which usually takes place in universities, if social workers can come in to give preventive education, to educate students during their orientation programs, this will help them understand that, okay, even though you see your fellow students doing this, you don't necessarily have to go in. You can actually advise them to come in. They will also understand the cons of this internet fraud, understanding it is illegal, and they will be known as criminals when they go into this. And also, it will orient them on things they can do better instead of going into internet fraud. Other things they can do to assist themselves in school. Then also, government and institutional stakeholders should expand youth empowerment initiatives, including skill acquisition, employment opportunities to reduce economic vulnerability. So we also found that economic vulnerability is one of the major reasons why undergraduates go into this internet trend. So government and the institution stakeholders of the University of Lagos could expand youth empowerment initiative. They can create skill acquisition programs for students, create employment opportunities for them for when they leave school, in the sense that they will focus on their school and know that the fact that when they come out and they do well, they will be able to actually find jobs, and they're able to actually acquire skills while in school that will sustain them when they leave school and sustain them even when they're in school. This will help them not to go into internet fraud. There's also need for sustained value orientational programs to promote integrity, patience, and legitimate pathway. I've already explained this also. Is in the same of continual. So first of all, I said there should be student orientation. Also, there should be orientation of other students in school. There should be continual orientation of students in school, just promoting their integrity, patience, having patience to continue in the path, continue the step-by-step process of making work. So
Okay.
Thank you, sir.
Pascaline, thank you very much.
Thank you, sir.
For the presentation. We appreciate you and appreciate your group for the effort you have put in. Okay, we'll give the floor now to Dr. Peter Adenibunyo for his review. Thank you, sir. You have the floor, sir.
Network.
Hello?
Yes, please. Go ahead, sir.
Okay, thank you very much, Dr. Atere, for this privilege given me to review this work. And I can say from the topic, the internet fraud, I think internet is also influencing the presentation and all these network we are having today. So the internet is not even stable. Probably is also part of the broad things among youth we are talking about today. All right, thank you so much, sir. Let me also join you to congratulate the group members for the job well done so far about this topic. And if you also look at this topic, it's also one of those things that is rampant among our youth. Nowadays, nobody wants to work anymore. People want to enjoy themselves, ride a big cars, and live, in luxury. So looking at this topic now, the topic is talking about perception of internet fraud among undergraduates in the University of Lagos, and looking at implications for social work practice, and provides an in-depth examination of pertinent social issues, internet fraud, particularly among the youth. And if you look at the abstract from the abstracts given, the study employs a qualitative research design to capture all different kind of issue that has to do with, make it quick, especially among the students, and also drawing vital connection to social work practices. So from the abstract, the findings indicate a troubling normalization of internet fraud as a coping mechanism for economic hardship among the youth, alongside various social influences that also shape all these perceptions about making it on time. Well, I must also commend this group for job well done. But however, there are several areas that also require attention and correction. Firstly, there are issues relating to clarity and conciseness of the writing. For instance, the abstracts should be more precise, straight to the point. And instead of using many words, you can use some few words. You can combine some few words together to bring about brevity and allow for a clearer articulation of the main findings, which is also important. Then another area which I also believe that we should also look into is that I would also like to suggest to the group also to try as much as possible to carefully proofreading and editing their work. And this is also going to enhance, the overall readability and professionalism of this paper they are also sharing with us. Then secondly, there's a noticeable inconsistency when it comes to or regarding the citation, especially citation format through how the research. If you look at section B of that work, for example, the study referred, reference do not follow a uniform citation style. If you look at the way they were looking at, references or citations, it's not tally, it's not the same thing. So I would like to recommend that they should stick to one particular single citation format, either APA or any other one that has been approved by the institution. Also, if you also look at their presentation, their work also, you also see that the group have also done a lot of good work when it comes to the theoretical framework. So from there, from their own, from the research, they gave us two different types of theory. The first one, they talk about social learning theory, and at the same time, sociological perspectives of deviance, and other area they also talk about. If you also look at all these theories, they should bring it down, to what is really, really happening in the life of the students they have, the 12 students they have carried out this research on. And this, by doing this, also going to provide stronger theoretical backing to strengthen this academic, rigor of the studies, and also provide a firmer basis of their recommendations that they are trying to make. If you look at the methodology they adopted, which I also mentioned before, was qualitative research design, which is appropriate, given the study's objective to gain in-depth into student experiences and perception about internet fraud. So, and they also make use of the semi-structure and in-depth interview, which was also good, which also they did online, conducted online, more or less like demonstrating adaptability of contemporary ways of gathering data or data collection, which is also one of the best way, we can also look into. However, the researchers, they selected a small sample size of 12 participants, well, which is suitable for qualitative study. And there might be need for clarification on how demographic factors such as academic level and department. If you look at the selection of the students or the participant they used, they didn't even really tell us the department and the level or all the other areas that can also help to influence their perception about, internet fraud. They're looking at sampling technique. They use purposive and snowball sampling. And this also has enabled the researcher to identify relevant participants, which I think is also really good. Although a clearer justification of the selection process and participant demographic will have enhanced the rigor of this of the study. And looking at the design, the research design also is effectively integrating theoretical framework, particularly social learning theories and sociological perspective of deviance. And all this has been able to explain the normalization of internet fraud, especially among the students. So if you also look at the finding, also shows that economic hardship, peer influence, and social media exposure are also significant factors, shaping students' perception about, ability to make it quick and also, to get rich. And other the analysis, they also use thematic analysis was also employed, to analyze their data. And also all these are also aligned for structural identification of key themes for the interview. But however, the presentation of these findings lack detailed thematic coding or sample codes to substantiate the claims throughout the results section, which could enrich the analysis and provide clearer contextual insight into the participant view. Because if you look at it, it's either they write it in a way, they use some italics that they use to show that this is what is coming up from the participant, which is also going to also make it better. Then the discussion of the finding also aligns with identified theories and also provides a sound narrative for implication of social work practice, which is also commendable. Then looking at the recommendation, the recommendation also advocates for multifaceted approach, to address the structural and behavioral dimension of internet frauds, calling for value reorientations and proactive interventions by social workers. So these sections also effectively highlight the necessity for tailored programs focusing on youth empowerment, which they also mentioned during their presentation, counseling, and at the same time, early intervention. With all these things I've said, I still have some things to also add to it. The research itself, the research overlooked discussing potential ethical consideration. Okay, they didn't even look at what are the ethical considerations tied to conducting interview on a sensitive topic like internet fraud. People can easily stigmatize and also label people once they get to know that they are into all this kind of yahoo, which one of the presenter also mentioned. Then adding a section on ethical safeguards can also safeguard, some ways of making the work more robust and also help in area of methodology. So finally, under the recommendation section, a few suggestions appear somewhat vague. It should also be able to bring about a way of breaking it down into details, how to implement these interventions, which they have found from their findings, and see how they can collaborate all these their finding with relevant stakeholders and see what each of the stakeholders should do in area of given actions. Not just saying they will do this, government will do this. What are the specific areas? What are the things expected of parents and all the caregivers they also need to do? If you look at all these little corrections, I think this project work is fantastic and it's good to go. Thank you very much, sir.
Thank you so much for that commendation, Dr. Peter Lenebuyon. We appreciate you as always. You've always been apt and doing justice to reviewing of papers. We appreciate you, sir. Thank you. We appreciate. Group
Thank you, sir.
F, there you are. So please try and comply with the corrections when it is sent back to you so that your paper can also be publishable and published with the Institute Professional Social Work Journal. Thank you. Okay, we go from there to the next group, which will be group G. Group G, the reviewer is social worker Ferdinand Omoja, and the work are supervised by Professor Levi Odike. Okay, do we have Eya Oyibo there?
Yes, sir. Good afternoon, everyone.
As a group lead, thank you. Eya Oyibo has also been a very consistent group leader. We appreciate you.
Thank you, sir.
Okay, do we have okay, we have just 3 active participants. I'm a candidate in that group. Okay, we have Jimo Louis.
Yes, sir. Good afternoon, sir.
Okay, Adeshola Favor.
Yes, sir. I'm here, sir.
All right. Ayodele was not active with the group. Egumandi Edu was not active with the group. Inyang Ufot was also not active in the group. Out of 6, there are 3 active participants in this paper. All right. Thank you very much, the 3 of you who cooperated to present this paper. All right. Eya Oyibo, please, you have the floor as the lead.
Thank you. Good afternoon, everyone. My name is Favor. Paperwork in the social work transformation and artificial intelligence in the 21st century in Nigeria. So we all know that AI has come to stay, despite all the screaming that, oh, AI is going to replace so many things, but AI has come to stay. So we are looking at how AI can now transform social work. This paper examines how AI can transform social work in Nigeria by enhancing its professional training, improving outreach, and strengthening the welfare, promoting database and decision making. So we're looking at how AI can help in to drive database and decision making. How experts can make decisions even with the clients and the service user. The analysis highlight the importance of cultural sensitivity. So AI might not be cultural sensitive, but when we go through the paper, we get to know that we want to see how AI can be culturally sensitive, especially in a Nigeria setting. AI adapting community values such as the beautiful philosophy in Nigeria social work. The study aims to assess AI importance on social work in Nigeria, identify enabling factors and barriers, and propose recommendations for inclusive, ethical, cultural, and sustainable implementation. By integrating digital skill training into social work curriculum and promoting stakeholders partnership, including the government, NASA, technology firm, Nigeria can harness AI to address social welfare challenges equilibrium. The recommendation emphasizes a balanced strategy that aligns innovation with Nigeria's social value, ensuring that AI-driven social services are accessible in an ethical, cultural, and relevant manner. Also, we're also looking at how AI can be sensitive and sustainable. The use of algorithms, data-driven policies and practices. Globally, most states are using AI now. However, Nigeria still faces unique challenges, including limited digital infrastructure, low internet penetration, just like we've been having since, language diversity, low digital literacy among practitioners, especially those in the rural area, and cultural values that emphasize community and empathy. We all know that social work has to do with empathy. with AI and the transfer, improve efficiency, but also the part of this study rests in this critical analysis of how AI can positively transform social work in Nigeria, where we fully honor the country's socio-cultural realities. The paper demonstrates how digital technology can be utilized strategically to tackle persistent social problems such as poverty, ineffectiveness, welfare targeting, and why also improve implementation barriers. So what are the objectives of this paper? One is to examine the current and potential roles of AI and digital technology in Nigeria, social work practices and education. Another thing is to identify the second is to identify the opportunities AI can offer for enhancing social work services delivery, our training targeting vulnerable population in Nigeria. Another objective is to assess the challenges and risks, technical, ethical culture associated with adopting AI in Nigeria. So if we adopt AI, what are the challenges? What are the risks? The fourth one is we want to propose culturally and ethically informed strategy for integrating AI into social works, aligned with Nigerian values and needs. We all know that AI did not originated from Nigeria. So, but if we're going to be using it in social work, we have to find a way where it can align. What are the research questions? How is artificial intelligence transforming social work training, practice, and service delivery in Nigeria? What socioeconomic, cultural, and technological factors facilitate or hinder the integration of AI in Nigeria? So if we want to introduce AI into social work, what are the technology and the barriers we will face? Another question we need to ask is which social work theories and perspectives can guide the effective use of AI in this context? The last one is what recommendation can ensure that AI-driven solutions in social work are inclusive, ethical, cultural, and appropriate in Nigeria. We looked at
Favor, thank you so much for that beautiful rendition. We appreciate you. Then let's go to Jimo Louis.
All right, sir. So I'll be starting from the literature review. We are able to review from 3 contents: the global and African context, digital transformation in Nigeria social work, and also AI in social welfare and education. So global and Africa context, a literature on social works and technology highlights a growing trend where digital tools and AI is being introduced, crisis interventions, and identifying systematic bias. A recent review establishes that digital technologies has
Please
become...
just go straight to your theories and methodology.
Okay. The theories. We have 6 theories. Six theories, yes.
One or two, just give us the most important on 1 or 2.
Okay, I'll be talking on 2, the structural functional theories. This perspective sees social work as a professional fulfilling society needs, and applying structural functional lens to argue that social works must integrate into national innovation system in order to address new vulnerabilities in the digital era. From this point of view, Nigeria social work profession should align with national AI and digital policies, thereby ensuring that these practitioners contribute to and benefit from the broader technology infrastructure. The second one, system and ecological theory. Social work often uses system theories to consider the person in environment. Applying to this technology will enable us to view clients and social services within the digital ecosystem and influences as family, community network, institution, and the tech infrastructure itself. So the perspective. So we have ethical perspective, we have cultural perspective, and we have digital inclusion, right-based perspective, and professional perspective. So I'll be picking the first 2 perspectives. That's ethical perspective. This focuses on balancing efficiency, the principle such as confidentiality, consent, fairness, transparency, and the protection of vulnerability populations. This indicates that data privacy law and transparent are crucial in Nigeria social works. For example, any AI system used for case assessment should enable social workers to override automated decision if they conflict with the client's best interest. The cultural perspective. This emphasizes that Nigeria ethical, linguistics, and communal diversity. AI system must be adaptable to different culture. For instance, a chatbot for counseling should be able to support Nigeria major languages and recognize cultural idioms. According to Ubuntu African Humanists, perspectives call for preserving interpersonal care even as tech is used. AI should not be displaced the community-based post on. So the models are technology acceptance model, person in environment model, predictive analytics model, digital social work practice model, social technical and ecological model, and human-centered AI model. The models, the technology acceptance model, that's the same, helps to predict which AI tools social workers will enhance. The personal in environment model, this interesting social work model suggests assisting how digital intervention impacts clients.
Just go straight. In 1 minute, your methodology, please.
The methodology. This study employs a qualitative literature-based approach. It systematically reviewed peer-reviewed journal articles, conference papers, policy documentations, and professional reports from 2018 to 2026. And also, the analysis employ a thematic synthetic method to truly extract empirical findings, integrate expert opinions, evaluate best practice recommendation, combine diverse professional insights, and organize these elements within the framework covering opportunities, challenges, theoretical structure, and cultural factors. This study identifies patterns and formulates context-specific conclusions. This approach enables the study is grounded in current evidence and highly applicable in Nigeria specific context. Those are our.
All right, thank you very much. We appreciate you. Can we have additional favor?
Thank you, sir.
Yeah.
Okay, so going by the findings, the literature and policy reviewed the following keynotes. One, enhanced training and collaboration. Digital platforms have significantly expanded access to social work education and professional collaboration. Nigerian practitioners can now participate in webinars, online courses, group discussions, and virtual conferences that were once accessible only abroad, just like we're doing now through internet, and the availability of technology. We are able to converge on this platform and have this discussion. Another thing is improved outreach and access. Technologies like mobile apps and SMS-based information systems enable social workers to reach remote and underserved communities. For example, NGOs have piloted SMS counseling lines for domestic violence survivors. providing immediate help where local services are scarce. So imagine AI chatbots can also offer basic mental health help and support or information on services 24/7. That's 24 hours, a day. So help, which also helps to overcome geographic barriers and staff shortage. Another finding is that number 3, data-driven decision making. AI tools such as machine learning for mapping and predictive analytics can help governments and NGOs to identify vulnerable populations more accurately and allocate resources efficiently. This way, resources are being managed. You don't, like we have it now, maybe there are some locations that have more resources than the others, but with AI tools, we'll be able to map out the poverty, the location that needs more, or make sure there's a balance in the distribution and allocation of resources. Another is technology in education administration. In schools and educational institutions, AI can assist in social work roles. For example, school social workers could use AI-driven systems to monitor students' well-being metrics, automatically flagging those who miss classes frequently or show learning difficulties. This way, we are able to, as a school social worker, you know where to encourage the children, the students to put in more effort, you know where they are lagging, and we'll be able to, balance the whole, the needs. Another is capacity and resource limitations. The most cited challenges include Nigeria's infrastructure gap, especially unreliable power supply and low internet penetration in rural areas, as well as limited digital literacy among social workers, as cited by Odo et al. 2025 and Adaramola 2026. Obviously, while we started this session, we've been having network issues. So this is one of the findings that will help us to, target what the problem is and know how to make good use of the limited resources we have. Even the digital literacy among social workers needs to be studied and improved upon. So many social service agencies lack up-to-date equipment or budgets for IT. Consequently, social workers often use basic tools such as smartphones, tablets, and offline apps, but have little exposure to advanced AI systems. This is cited by Omokabi 2023. Another finding is ethical and cultural concern. There is widespread recognition of ethical issues, privacy of client data, informed consent for automated assessments, and algorithm bias are of significant concerns. Yes, for instance, a poorly secured cloud database could expose personal information. An AI decision support tool might misclassify clients if trained on biased data. So consequently, the social worker should have an understanding following the ethical and cultural concerns. Another is institutional and policy momentum. Nationally, Nigeria is building a regulatory framework for AI. In 2024, Nigeria published its national AI strategy with governance proposals for transparency and risk management. And in 2025, bills were introduced to establish a national AI commission and regulate digital economy platform, as cited by Adaramola 2026. Similarly, Open Government Partnership reports notes plans to adopt a national policy on the ethical safe use of digital technologies by 2027, as cited by Open Government Partnership in 2024. So this development indicates an enabling policy environment. So for social work, this means that guidelines, data protection, laws, and institutional support may soon be strengthened at the national level, which practitioners should utilize. So another one is social work regulation. Stakeholders have highlighted the importance of professional regulation in guiding technology use. Nigeria enacted the Social Work Council Act in 2022, but as of 2025, the council is still not fully operational. So once operational, this body could set standards and training requirements for technology in practice. The advocacy around its establishment underscores social workers' commitment to standardized ethical practice across sectors, as cited by CLEAR CLARE 2025. And the last but not the least of the findings, interest in inclusive development. Nigerian social work leaders are calling for inclusive AI development. The reviewed sources highlight the need for Ubuntu-informed.
Thank you so much, Adeshola.
Thank you, sir.
We appreciate your group for your presentation. Let's go to social worker Ferdinand Moja, the reviewer. Are you there, sir?
Yeah, good afternoon, Dr. Atere, and
Thank you very much for being patient with us since the beginning till now. We appreciate you, sir, as always.
Thank you, sir. Thank you, sir. Thank you.
You know you are an insider, so you don't. I have to push you to the end or towards the end because you are an insider.
Is all right? Is all right, sir?
All right, thank you.
You're welcome,
So,
sir.
social worker Ferdinand Moja is a lecturer with the Federal University of Allied Health Sciences, Enugu, and also the practicum coordinator of the Chartered Institute.
Thank you so much, Dr.
You're welcome, sir.
Thank you in the house. Yes, social work transformation and artificial intelligence in the 21st century. I've gone through your work and I've seen a lot of beautiful things that you've put out to achieve. And you decided to go on artificial intelligence. Just some few weeks ago, it has come to stay, and there is nothing we can do about it. Just as the first presenter said, you know, we are struggling to do a lesson plan on something. So we have, you know, tried to crack our brain to get some weeks, but we are battling for deadline. Then all of a sudden an idea came in. The remaining week that if you continue the way you are cracking your brain to pursue, you may not be able to beat the deadline. Why not go to ChatGPT to see if it has something to offer? So we put in the objective, the topic, use the other format we use in writing other lesson plan. And in seconds, we are having a very beautiful lesson plan. But there is a danger to it too, because we need to begin to look at it line by line to humanize it, to make sure that it suits our environment. And so within 45 minutes, we were able to achieve what we are struggling to achieve between 3 hours to 4 hours. So AI has come to stay. But again, looking at your topic the way it is, I've said you have done a very good work based on some content I've seen in what you have in your work and the way you are presented. You also did a very beautiful presentation. The three of you are prepared and you gave us very wonderful presentation, and you are presenting what you sent to me, which is also a bonus. Now, but looking at your topic the way it is, social work transformation and artificial intelligence in the 21st century, my first question was, what did the group set out to achieve with this topic? And I said before, I've said that AI have impacted different facets of discipline and life. But having the topic the way it is does not give direction to the seminar. So I'm suggesting, the reason why I'm suggesting that, can you work on the impact of artificial intelligence to social work in 21st century in Nigeria? The impact. So when you put the impact, it provides opportunity for you to discuss both the positive and the negative impacts, which is one of the objectives you set out to address when you are talking about the challenges that has to do with making use of AI. Alternatively, because along the line, you people are talking about artificial intelligence and talking about digital technology. I know artificial intelligence is part of digital technology. Do you want to focus only on artificial intelligence, or you want to focus on digital technology? Or do you want to find a way to combine both? Because along the line, I will see you, once you mention artificial intelligence, before you know it, you move to digital technology. Digital technology is broader than artificial intelligence. So you need to find out what you really want to achieve in this topic. Do you want to include artificial intelligence / digital technology, or do you want to talk about impacts of digital technology in 21st social work practice in Nigeria? I hope the point I'm making is very clear to you.
Yes, sir.
Yes, sir. Thank you, sir.
Okay. Now, another issue I have with your decision is that there is a format given to you to write this seminar. You did not follow that format. And which means that is indeed for you, when we finish this seminar, go back to the schedule where your name appeared and look at the section, be part of it to see how we are going to, structure this seminar. I have section, C section, D. So that arrange your seminar in that order. So from what I have from that document should be under section A, then your introduction to your abstracts. I've actually okay. Can you hear me? I discovered that it's like I had a glitch.
Yes, sir. We can hear you. It was glitching.
Okay, yes. Now, I'm looking at the second, like how many paragraphs here? Have like identity to be in one paragraph 3. Then I'm seeing in your second paragraph, drawing on recent study. I didn't argue with that. Expert discussion. Where did you get this expert discussion? You understand? I just asked you where. So if there is no expert discussion, you don't put it there, because it is expected that in your findings, you are going to give us what you get from the expert discussion. But if there's no expert discussion, just expunge. Then I'm looking at this study aims to assess AI's impact on social work in Nigeria, identify enabling, the way this sentence is sounding, and propose recommendation is showing that you have not finished the work. Everything in your abstract should be in the past tense. So this study aims to assess AI's impact. To assess, you understand, on social work in Nigeria, identify enabling factors. So you should have a way to put this your abstract in past tense. Then, I'm also saying that those impacts of AI, enabling factors, barriers need to come out clearly. Should be able to define your findings. Should be able to say, what are the barriers? What roles have AI played based on the literature you reviewed? What are the enabling factors? You should be able, at least one of them. That are the things that will come out from your findings. Then a very major issue with your abstract is that there is no methodology. There is no methodology. The methodology did not come out clearly. Although I was able to see it in the body of your work, you should find a way to put your methodology in your abstract. So when you state the topic, you state the objective of the work, you state your methodology, how you are going to get material. I know it is a review of secondary data, but it needs to come out clearly. Then you now state the findings. After stating the findings, you should be able to have at least one recommendation. Not the way it seems you are playing with the word, try to write some beautiful things. At abstract level, you need to be hitting the nail at the head because you have done it. So you are no longer doing guesswork. I hope that is very clear. Then I have another one of your work. Some of the subheading appearing in color, blue color. I don't know whether I don't know. I don't want to use AI from the source. You get your material from and you just push. And where you have social work transformation and artificial intelligence in the 21st century in Nigeria, it is not necessary. All you needed to do is to do introduction, provide background, tell us the challenges, state the problem, and you done. You have a one-page introduction. I don't have problem with the one-page introduction because it needs to appear under introduction. Not, you are writing as if you are writing an opinion article, not a seminar. So then, now come down to what I was discussing in your topic. I'm saying that where you have the paper demonstrates how digital technologies can be utilized strategically. So I now said your work is on artificial intelligence, not digital technology. So focus on your topic. But since I've given an intervention, it is something you are going to discuss with your supervisor to know whether we are going to replace artificial intelligence with digital technology, which means if you are now using digital technology, you are going to include other platforms apart from AI, of which you also did in your work. There are places you are including Zoom, you are including some other digital technology platform. You know, so if that is what you set out to do, digital technology, and the impact of digital technology in 21st social work practice in Nigeria. And I say your introduction is fair and straight to the point. And you have a blue objective, you should be objective of the study. So, and your first objective, examine the current and potential role of AI and digital technology, you know, mixing of AI, digital technology. I think that point has been made. So anywhere you see, just know that I've made reference to it. And I say be consistent with your topic. Now, your research questions did not align with your research objective. And this is what I mean. If, for example, your research question 1 is to examine another issue with your research objective, because you have objective. So if you are writing this way, you can now to examine, to identify, to assess, to propose, so there must be 2 in each of your objective. But if you say that the objectives of this study, are 2, if you now write that and put your pom-pom colon, you don't need to begin to put 2 in each of the sentence. But since you don't have that kind of introductory statement, you will now start each objective with to examine, to identify, to assess, and to propose, etc. Then to your research question, your research question did not align with your research objective. The research question is saying a different thing. Your research objective is saying a different thing. They must align. So if, for example, your research objective 1 is to examine the current and potential roles of AI in Nigerian social work practice and education, Your research question should be, what are the current potential roles of AI in Nigerian social work practice and education? If your research objective number 2 is to examine the opportunities offered by AI, your research question will be, what are the opportunities offered by AI? So just follow it. So research question 1 will, the research question 1 will speak to research objective 1. Research question 2 will also speak to research question 2 will also speak to research objective 2. That way, and you go down. Now, your literature review is okay. The problem again is that it didn't appear under section. So you need to have it under section B, literature review. Then, and I've made the point, you may consider including digital technology in your topic. But that will make you to also bring in other digital technologies apart from AI. So we need to be really guided on that. Then, there was a place you were putting somebody, I think Omokabi 2023, recommend collaboration between organization and professional association, like NASO to promote blah, blah, blah. In particular, she urges. You know, you don't use she urges. How are you sure that Omokabi is a he or a she? Because Omokabi should be a surname. So how sure is a she or is a he? You know, so you can now say the scholar argued that Nigerians spending social work so that whether it is a he or a she, that takes care of it. And again, I'm looking at that same sentence again, that Nigerian Pending Social Work Profession Act. He said she urges that Nigerian Pending Social Work Professional Act be axed. And my question is there a pending social work professional act that is pending in the National Assembly? And you are putting on Mokabi 2023. And I say that I'm aware, or I say that I know the C-ISOWN Act is passed and it's running. If the C-ISOWN this thing is not passed and running, you will be doing what you are doing today. And I also say that I'm also aware of the passing of the Social Work Council Act in 2022. So which pending Social Work Professional Act are you talking about when you are talking about urging them to pass the pending Social Work Professional Act be passed? And you are putting a document of 2023. Meanwhile, that of Chartered Institute was done in 2022. That of Council of Social Work also came up later, that's in 2022. Except if there is a new pending Social Work Profession Act that I am not aware of that is pending in the National Assembly. So you need to be guided. Now, there is a place where you have key teams under your literature. I just said not necessary. What it means is that delete all those things you have in your key teams, the potential benefits, the ethical and practical setting, the capacity building, the cultural and social fit. Just expunge theory. This is where you people did, I don't know. This is like, come and see American Wonder. I'm seeing like 1, 2, 3, 4, 5, 6 theories. And you come to perspective, you have like 1, 2, 3, 4, 5 perspective plus 6 theory, 11. Have to model, you come 1, 2, 3, 4, 5, 6. Like you reviewed like 17 theories, perspective, and models. So I now said, maybe because you saw in the template theories, perspective, and model, you can pick one theory, one perspective, and one model. That is maximum 3. You don't need all these things. And for you to be able to review all this theory, there are modalities for writing theories. First of all, I said the theory should not be more than 3. Also, in each of the theory used, you need to state the proponents, those who propounded the theory, basic assumption or tenets of the theory, then link the theory to your work. You are done with each theory. You understand? So that you don't have all these something that looks like AI generated theory explanation. 1, 2, 3, 4, 5, and they don't need to appear in numbers. You don't need to number them. You just need to write, for example, if you are writing a social learning theory, just have social learning theory. You state the proponents, the major tenets, the assumptions, how it is linked to your work. You move to the next theory, and you could have that under your theoretical framework. Then, what else? Then your materials and method, I say it should also appear under section C. I'm okay with your material and methods, but they must be reflected in your abstract. I think I've made that point. It is completely missing in your abstract. So find a way to put your materials and method in your abstract. What am I arguing with? Okay, a place where you are saying that a professional report from 2018 to 2026, and I say this is not true because I've looked at it. I did not see 2018. I did not see 2019. I think I saw 2020. Though I did not see 20. I think I saw 2020, 2021. Did not see 2022. So you can just say 2020 to 2026 is still allowed. You are not going to impress anybody by reducing it. You understand? Some of these things, the reason why we point them out is that it is what you wrote, not what somebody imposed on you or coerced you to do. It is you that wrote it and you presented. So if you say you review the work from 2018 to 2026, I should be able to look at it and see a work that quoted 2018, 2019, but I didn't see 2018, 2019. So I'm suggesting you should start from 2020 to 2026. I really commended some of the references you used. They are quite very recent. I saw a whole lot of 2023, 2024, 2025, and 2026. But you need to remove 2018 and 2019, start from 2020. Then your findings. Your findings is where I think you need to do a very, you need to present your findings in teams. Because you did a qualitative study and analysis, you should be able to provide them in teams based on the literature you review, and they are going to reflect. You need so that they reflect what you have in your objective. The whole essence is that your findings should be speaking to your objective. Now, I said your findings should be under teams, not numbered. You went and numbered your findings. The way it is currently constituted, the team will be drawn from your objective of the study. For example, you can collapse your objective 1 and 2 to become one sub-team or one team for your findings. So under your findings, the first thing will be roles of AI and opportunities AI and digital technology offer to enhance social work service delivery and education in Nigeria. The ingredients to speak to this team is already there in your work. You can use your findings in number 1, number 2, number 3, number 4 to discuss this team, the findings in your team, and you make it to be a bit narrative so that somebody that is reading it, because it is a qualitative study, it has to be a kind of a narrative essay so that somebody reading it will flow. If there are places you need to disagree with some findings, you disagree with some findings. If there are places you need to concur with or agree with some findings, you also agree in those places. Then your team 2 should be challenges and the risk associated with adopting AI in Nigeria. Then you can include your findings in number 5 and 6 and discuss them under team 2. Then in team 3 should be the cultural and ethical strategies for aligning AI into integrating Nigerians' value and the needs into social work practice. Then you can now include your findings from 7 to 9. So you now have 3 teams for your finding instead of having number 1 to 9. So your team 1, where your findings 1 to 4 can be used to discuss your team 1. Your findings 5 and 6 can be used to discuss team 2. Then your findings 7 to 9 can be used to discuss your team 3. Then I also say that your findings should be under section D. Then, while I was making case for the digital technology, I said that I saw some certain things here, things like when you are making reference to group discussion, visual conferences, e-mentoring, professional groups, social media like WhatsApp, LinkedIn, So if we are making references to all these things, what it means is that I think this comes under your findings. So all these things come under digital technologies instead of trying to emasculate them under AI. It is going to be a very serious, for me, going to be a very serious error. Then, okay, I'm looking at social work regulation. I'm saying that I'm glad you mentioned this here when you talk about Social Work Council Act in 2022. So I say that because you have talked about this earlier in your literature review, surprisingly, you did not mention the Chartered Institute of Social Work Practitioners of Nigeria, where you are presenting this seminar, and which have continued to actively engage state actors in promoting social work in Nigeria. So you were, you know, one that is not active, that is not up and running, but there is one that is up and running. So I was thinking that you should have something for C-ISOWN to do. You understand? Because C-ISOWN, the Chartered Institute, is up and running. I know we have been having our conferences on a yearly basis. We have been engaging in all these refresher courses, certification courses, and some other things we are doing. At least when Dr. Tere is in, say I'm the practical placement coordinator. So you should have something for something that is standing and running. And if I'm not saying that you should not talk about those that have not hit the ground running. I'm saying that if you have something that for those who have not hit the ground running, then you should have something for those who have started doing something. That is the point I'm making. Then a place where you quoted clear 2025, I say should be able to state the full meaning first before you begin to make use of the acronym in subsequent write-up. I'm seeing a lot of subheading in colored letters. I'm wondering why that should be so. Then, towards end of your findings, you started talking about implementing this recommendation required a multi-level action, which ensures that I say it's not necessary. You have made your recommendation. You have made your recommendation. So forget this last paragraph. Conclusion. I say try to make your conclusion to be one paragraph. Then I have very serious issues with your references. I'm struggling to know the referencing style you use for your work. The end text references is poorly done. I'm looking at it. I wanted to do one or two. Seems like the thing was giving me headache. I just said the best, the approved style for this seminar is APA 7th edition. So go get the APA 7th edition and make sure you complied with it. So by and large, you have a lot of ingredients to make this work to come out very well. I think the problem is in organization, so that the work comes out the way it's supposed to come out and give it the kind of credit that it deserves. Thank you very much. Thank you everyone for listening.
Thank you, sir.
Thank you very much.
Thank you, sir.
All right, thank you very much, Group C. Thank you very much, Social Worker Ferdinand Omoja, for that incisive review of Group G's work. We appreciate you as always, sir. And I'm blessed.
Thank you, sir.
When you receive your Group G, when you receive your reviewed work, please try to comply and get back to your supervisor or your mentor, Professor Odike, so that you can look at it together again and then get it to the point of publishing in the Professional Social Work Journal that is coming up. All right.
All right, sir. Thank you, Director. I hope to get it from them back. Thank you so much.
It's all right. Thank you very much, Prof. All right. Let's go to second to the last. I've not
Ask a
seen.
question, sir. Dr.
You said?
Terry, okay.
Yes.
I want to
Who is
ask a
that?
question.
Question from who?
I thank you to our doctor that are we going to get the review or
No,
before
sure,
we've
sure,
jotted
sure.
down, we'll just work on?
We are going to send it to the group leader. You are the group leader now. We are going to send it to you.
Okay, sir. Thank you, sir.
All right. Okay. Thank you very much. All right. We go to group A now. I think Dr. Vivian is on the waiting. Dr. Vivian, are you with us now? Dr. Vivian.
Sir, Group D has not presented, sir.
You said?
Group D.
Yeah, I know you've not presented. I've been trying
Yes,
to
sir, you mentioned that she said okay.
I've been trying to get in touch with your reviewer. I've not been able to get through to her, so we are waiting. I keep tapping her. So that's why I want to take group A now. Dr. Vivian, are you with us? Just wait, group A.
I'm with you, sir.
Oh, okay. Thank you very much for being there. All right. Okay, group A, yes, we started the other time, we had to step you down. Ibuzo Alma, can you please take the floor? Thank you.
Okay, good afternoon, sir. Good afternoon to our reviewer, and good afternoon, everybody. Our topic is on child welfare services in high conflict marriages and divorce. And we started by saying that child welfare is central in any country, in any society, in building a healthier and sustainable society. And then the family remains the primary social institution that actually takes care of the needs of the children and helps in human development and socialization. And then it's also important to note that in European countries, there has been a direct shift from the family setting. So now we have people who are engaging in cohabitation, divorce rates are increasing with union dissolution and rising childlessness. And all these things have influenced the family structure. And then, according to the United Nations, we also see that there is a global rising rate of divorce, with about 40 to 50% of people, of marriages ending in divorce, especially in the Western countries. And then, even in sub-Saharan Africa, the rate of divorce is actually increasing, especially in places where there's an intersect between the urban areas, that is modern and old lifestyle. And then when we domesticate it to Nigeria, we see that Nigeria, that was once characterized by a low formal divorce, is now experiencing a strong shift in divorce. And still, this does not change the fact that people within Nigeria still value marriage or still uphold marriages. So as a result of this uphold of marriage, a lot of people are now willing to be inside or be in toxic marriages, especially women, especially they are willing to be in toxic marriages, and women usually face stigmatization and exclusion, especially when the marriages end, which leads them to stay longer in abusive and dysfunctional relationships. And then the children who are caught in this intersect, the children are the ones who now suffer the consequences of them staying within these marriages. So we also looked at studies that actually talked about divorce, child welfare within the divorce and the in high conflict marriages. And we found out that children who stay within these settings usually result to or have a high risk of aggression, anxiety, depression, academic failure, and dropouts. And then in some states, we also saw some studies that were conducted in some states, and it also supported these findings. And then going down to social work still remains very vital in child welfare settings, which includes the family. And then currently we have the Child's Rights Act, which maintains the best interests of the child welfare, their survival, their development as important. Then we also have the Matrimonial Cause Act, which also prioritizes child welfare in statutory dissolutions. So we also see that the family courts handle Child Rights Act disputes, and then they are being supported by the Ministry of Women Affairs and Social Development to actually carry this out. And then we also saw that most Nigerian children, even with this, unfortunately, they are still not enjoying the benefits of this act. And even when the international law favors swift exit from toxic environments for children, the cultural norms and religious norms often prioritize family preservation, and this actually tends to harm children. And then we talked about the fact that if we are not able to solve this, we may end up perpetuating cycle of trauma in that for children who are actually residents within these homes, and then they get to pass it to other their own families when they grow up. So we have some listed objectives of the study, and our broad objective is actually to examine the child welfare concerns associated with high conflict marriages and divorces and their implication for practicing social work. That is what social workers would do, and how can social workers come in to actually help in taking care of these children within these settings. And then our specific objective is to determine, first of all, to determine the major child welfare concerns associated with high conflict marriage, to ascertain the effects of high conflict marriages on emotional, behavioral, and social welfare of children, and to find out the factors that influence the extent to which children are affected in high conflict marriages. That is to know if this is actually a problem, and to know how exactly are these children affected, what are the major causes of this influence. And then lastly, as part of our specific objectives, we have to determine the implication of these child welfare concerns for the practice of social work. So the same thing, we more like replicated what we had on our objectives of the study as our research question. So for our first research question, we have what are the major child welfare concerns associated with high conflict marriages? And the second one, we have how does high conflict marriages affect the emotional, behavioral, and social well-being of children? For the third one, we have what factors influence the extent to which children are affected by high conflict marriages? And then the last one, what are the implications of these child welfare concerns for social work practice? So that is basically talking about our introductory part of our work. Thank you very much, sir.
All right, thank you very much for that rendition of your introduction. We appreciate you. So, okay, let's go to section B and C to be taken by, is Udi Princess there? Udi Princess? No? Okay. Is Olugbemiga Adunola there?
Yes, sir, I'm here.
Okay, let's have you. You have the floor.
Okay, so for the chapter 2, that has to do with the reviews of empirical data and theories that we employed in in the topic about the review. We looked at studies from 2020 and 2018. We looked at another study from 2017. There is another one from 2021, and all these studies uh, makes us to understand that child welfare and child welfare services are quite important in, especially in high conflict marriages and divorce, because when we take care of these children, the trauma that they go through are quite minimized, if not totally erased. We talk about the fact that most of the time it is women that initiate petition. That is, they are the one that come up with, when they are not satisfied with what is going on in the family, they are the one that make report so that their children would get a better life, so that their children will be well catered for. I work with a social welfare office, and we see most of our reports that even come to the office, they are mostly made by, of course, we have men that also come to report that this is going on in their family and how it is affecting the children. But most of the time, you see women coming to make the report that this is what is happening and this is how it affects the children and even they themselves. And then we see that most of the time, we also saw through our collection of empirical data, which we did through secondary data collection, that sometimes unforgiveness and strained social networks intensifies conflict in the family. When a situation whereby we do not let love reign, most of the time things that lead to conflict can be quite minimal. But when a third party or there is unforgiveness in the family, issues quite easily escalate and it leads to conflict in the family. We also find out from another study that um, 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 prolonged child exposure to family or parental hostility, it leads to missed opportunities and internalizing of these traumatic situations for children. And all these findings that we carried out in our empirical data collection shows the impact of all these conflict as it affects the children, as it affects their emotional life, as it affects the way they react to even others around them. And then we have the impact of these high conflict marriages and divorce on children. We see the study of that was carried out by a group of people, the William and Adekola team in 2024 in Kebbi, Nasarawa State, that difficulties, the children, the impact of this high conflict marriages on children is that is they begin to have unhealthy relationship with others. Some of them develop low self-esteem, they have abandonment feeling, they are aggressive and disobedient. And then some of them even tend to go into substance abuse just to cope with the home front, what they are facing in their family, what their parents are putting them through, consciously or unconsciously. Some of the time, it affects them and they start taking drugs, they start abusing drugs, and this also, it affects them negatively. And all this can be traced to the home front, what is happening in their home through a high conflict or divorce. And then in 2020, we also look at other impacts as seen as a study that was carried out in 2020 and 2021, that conflicts, interparental conflicts can be linked to aggression. We see aggression in the life of such children and poor negative mental health. All this impacts children in high conflict marriages and divorces. And then we look at the moderating factors of the effect of, that is the factors that lead to, the factors that affect the moderating factors of the effect of high conflict marriages on children. We see the severity, the frequency and severity of the marital conflict, it affects children. Some of the time where there is low, of course, there's no how a family will be together. The Yoruba adage says that even the mouth and the tongue they fight. But most of the time when they are too frequent. When the conflict is too frequent, there's a way it affects the children, and the severity also affects them. And then the age of those children also some of the time when little children go through such things, such high conflict in their homes that is being perpetrated by their parents, because of their level of understanding, they may not quickly, they can easily um find a way out, through mixing with others. They may not really understand what's going on, but as they grow and they experience these things going on in their family, it tends to affect them emotionally. Then the level of their exposure also are factors that makes this effect to be very, very prominent in the children. If they are exposed to this conflict for a long period of time, it affects them mentally. And then we talk about child temperament, personality, and gender. From our write-up, it shows that if most of the time the boys, when they go through high conflict in their family, they react with aggression, while the ladies, they tend to be withdrawn. They begin to experience low self-esteem, while the boys react with aggression, with disobedience, with stiff-neckedness. So, and then their personality, their temperament, those that are sanguine, those that are phlegmatic, there's a way they react to conflict. And all these things matter in the life of the child and how they turn out to be in the future. And then the way we also talk about the fact that social support systems and legal aids, how these children have access to these support systems and legal aids like counseling, social work services, also help them to do better. Some children, they don't even have, in some schools, they don't even have counselors. They don't have real counselors. I have schools
Okay,
around.
okay. Thank you very much. Let's take the last person in that group. Do we have Udi, Princess? Is she there? Can we have Olagoke Dari? Is he present?
Yes, I'm here. Good afternoon, sir.
Okay, good afternoon. Please, you have the floor.
Yes, sir. So, basically, like, I will continue
Findings
from.
and recommendation.
Yes, sir.
All right.
So, on our findings from our work, briefly, we saw that children involved in this high conflict marriage shows increased anxiety, depression, and aggression. Our study also find out that high conflict affects emotional regulation of these children, and their academic performances tend to decline significantly as a result of high conflict marriages and divorces. And then we also saw that their social functioning becomes impaired. And also, as part of the findings, we saw that the custody and cultural practices affect the outcomes of these high conflict marriages and divorces. And then we also found out from our study that there is weak implementation of the Child Right Act of Nigeria, and also the child right laws in states. And then as part of the findings, we also saw that parenting quality also influences the resilience of these children, and the social support impact of social worker now reduces the negative impact of high conflict marriages and divorces on these children. And we saw that from the study there are some factors influencing the outcomes. Number one, we saw family cohesion and parenting quality. We saw cultural and religious norms. We saw economic condition and instability. And then we saw, as part of factors influencing the outcomes, we saw strength of social support systems. And so what are the implications of this for social work? Number one is the need for early family intervention. Like the former speaker said, There is no way that people won't fight. She quoted the Yoruba adage that says, tongue and mouth also fight. So, but then there is need for early family intervention so that this fight will not be prolonged to the extent of affecting the children of this marriage. And then we saw the importance of mediation and counseling for not just parents only, but for children as well. And then the need for multi-agency collaboration. So our recommendation, number one, is that we recommended that there is, from the study, we recommended that there is need to have a strengthened family counseling services and conflict resolution services to mitigate interparental conflicts and its detrimental effect on children's mental health. Number two, from the study, we recommended that there should be an introduction and expanded school-based counseling and support system to counteract academic and emotional challenges faced by affected children. Number three, we recommended that we need to have improved enforcement of child protection laws, especially the Child Rights Act, and also prioritize child-centered custody decision in legal proceedings. And then we also recommended from the study that there needs to be building of capacity of social workers through specialized training in family mediation, trauma-informed care, and conflict management. We also recommended that we need to promote public awareness campaign. It's very, very important, and we also recommended that we foster interagency collaboration among social workers, schools, legal system, and health services to bolster child protection efforts. And then last but not the least, we recommended that we need to reinforce social welfare policies and services to promote family stability and safeguard children's well-being. Thank you very much.
Okay, thank you so much, Group A. We quite appreciate you. Okay, Dr. Vivian, Associate Prof, has been saying that there's network glitches, but let's see as much as we could take from her. Dr. Vivian, are you there with us?
Yes, Dr. Tere.
Okay.
Thank you for your understanding. Thank you for working things out so that at least I can get my role in this setting. Good afternoon, everyone. And this is Group A. We are taking Group A now, right?
Group A.
So, I don't know if the noise in the background is from my end or yours.
It's from your end.
Is this on? There's no noise in my end.
Okay. Okay, it's from Kayinde Akinwale.
Exactly.
Kayinde Akinwale, can you please mute your mic? Please go ahead, ma'am.
All right. So, Group A, I have gone through your work, and let me begin by commending you first on the use of slides. I was in and out while presentations were being made, but all the time I logged in to listen. I am not sure. I'm not saying there is none, but I'm not sure I saw slides being shared on the screen. I stand to be corrected. But be it or not, I appreciate the fact that you did due diligence to make slides available, because that assisted in following your presentation. The title of your work is interesting. Personally, I have a strong bias for child welfare, because I believe if we get it right at the root, we don't need to bother about the fruit. So when it comes to child welfare services, I usually love it when we go about it in pragmatic ways, in relatable ways, addressing our day-to-day challenges in this area. Most times as social workers, we stand at the gateway of maturity, social maturity, where we begin to identify problems of defiance, problems of antisocial behaviors, and things like that. But I'm saying if we pay half as much attention to the care rendered to troubled children, instead of just standing at the point where we begin to x-ray and analyze what they are not doing right, I believe we will take the practice further down the road to providing solutions than what we have now. So it was with keen interest that I looked at what to put together in your research work. And although the topic is straightforward, I mean, the title of your paper is straightforward, it gives an idea that you only want to do a kind of descriptive study to provide general information concerning the state of affairs when it comes to child welfare services in high conflict marriages and divorces. It's clear from your topic that we are not expecting field work, we are not expecting primary data, although I would have really loved that, but you are also free to go this route. I'm on the looking at your abstract. I had a little issue. I read your abstract more than 5 times. The sequence of the abstract is okay. I mean, in terms of stating the problem, stating your methodology, but I got stuck when it came to the part of stating your findings. And that is the major challenge of this work. So let me just mention that. I will talk about that in detail when I get to that point. But that abstract would have been stronger if your findings was included. As far as I'm concerned, there's no findings in this abstract. We have a line that says the study highlights a tension between Nigeria's Child Rights Act. Is that your finding? The study highlights. Do you highlight? Do studies highlight? I want to. What I'm saying is, for you to say the study highlights, a study can highlight anything. That is not necessarily your finding. And the tension between Nigerian child rights and all of that cannot be the findings of your research. That has been overstated, overflogged. Everybody that have done anything in relation to child welfare in Nigeria have pointed out that divergence, that lack of synergy between Nigeria's Child Rights Act and the indigenous practices, sociocultural practices. It is overflowed already. So you cannot bring something new to the table from that angle. So that's why, outside of the fact of the use of language, which says the study highlights, if you are thinking that pointing out the tension between Nigerian Child Rights Act and the sociocultural landscape is your findings, I beg to disagree. The intro, it's relevant to your topic. At least I can see that you looked into the issues around the title, and that's in order. Although I don't know why the intro is this short. It is very short, almost too short, just like 3 paragraphs or so. I know there is a page limit you have to work with, but the intro is where you set the stage for what is coming, and I believe you can provide more relevant information in your introduction than what we have here. Oh, to the objectives of your study, yeah, they are well spelled out. I mean, the relevant ones. There are 4 objectives here, and from my review, I noticed that only 2 are related to your title. And from the moment you diverted at the stage of setting your objective, you duplicated your research and opened too many pathways that you can't possibly follow in a single seminar paper. Your title is straight. You want to look at child welfare services in a specific context. The services in a specific context. So, setting an objective like to ascertain the effect of high conflict marriages on the emotional, behavioral, and social well-being of children is totally objective alone can spit out into 3 different research papers, and it is not related to your topic. I am not saying you can't make reference to the effects of high conflict marriages and all of that on children, like you did in your intro. It's in order to mention the effect, but you can't set it as an objective because it's defining another part, and that is not where you want to go. Then the third one is like that, to find out the factors that influence the extent to which children are affected. That is huge. You want to tease out the factors influencing the extent to which children are. No, that's not even realistic, because I don't know, unless you carve out a specific research scope, a specific research setting, population, that will limit it for you. But if you look at this objective, it's so broad. Well-being of children. You know how many children are in Nigeria alone? So if you take out these 2 objectives, it will return your discussion back to focus. Because the moment you set your title, you put yourself under obligation to say, okay, this is where we are going. And as your reader, I already have an idea of where we are supposed to go based on your title. These objectives number 2 and 3 are not going to take us there. They will take us away from that. And the same thing, is duplicated in the research questions. So you need to look at those objectives and come up with questions that will address child welfare services. I was looking forward to getting information on maybe this kind of services that should be available. What are the services that should be available for these children in these troubled situations? What personnel are responsible for rendering these services? These are the issues I thought we'll be discussing. What are the policies that are supposed to anchor the services? What are the regulations in place to monitor the services rendered? What is the place of child welfare services in the Child Rights Act? Not the effects. That is not the focus, not the factors influencing. Are you with me, Group A?
Yes, ma.
All right. So please take one look at your objectives, set them right. Look at your question. Child welfare services in high conflict. Then ask questions that probe what is happening inside the child welfare systems within the scope that you've carved out for yourself. Not the problem now, but the services that should be made available for these children. Okay, so from there, we can move on to your literature review. And please note that the moment you set your objectives right, every other thing will fall in place. Because your literature review addressed the diversion more than the issue. Your review went around things like child welfare issues in high conflict marriages. That is okay. Then you moved on to impact of high conflict marriages on children. No, you can't have this to the detriment or to the exclusion of the real issues. It is maybe after you have opened up the issues around child welfare systems. What are the systems in place? What are the services in place? How available are they? What are the issues around the availability of these services? These are the things you are supposed to review that will keep us on track, not factors that moderate the effect of high conflict marriages. No, that is not what we are looking at here. So if they are coming up at all, there should be an addendum, an appendix, not taking the place of the main work. Theoretical framework is impressive. I totally understand why you would want to go for ecological systems theory. That is a good one that states that children develop based on the services, the systems available in their immediate surroundings. And you also made it clear how these theories are applicable to your work. That's a very good one. Not only stating the theory, but also letting us know how the theories would help what you want to do and how they are related to your study. I was really impressed when I saw that part in your theoretical review. Materials and method, it's also in order. That is clear. What you want to do is very clear. And all the subsections are well represented. So I give it to you in that area. Your instrument of data collection, well stated that you were going for secondary data. The methods of data collection is also clear. You can see a good amount of academic integrity coming up there, because you're making direct reference to the search engines you'll be using, to the sources you'll be getting your materials from. That's a good one. Now to your findings. There's absolutely no way we won't have issues with the findings because of that divergence at the point of setting the objectives. Now, this is what I suggest that you do. You reset the objectives, and then by virtue of that, reset your research questions, and then make sure your findings align with these two. If you set out to find out the systems available for child welfare, for example, in your findings, you are supposed to tell us the systems that are available. If your objective is to identify the rate of accessibility accessibility of these services, in your findings, there should be a section that addresses that. You're supposed to tell us what you found. But when you come to your findings here, you see that you are just echoing the submissions of others. Please, now, listen carefully. The fact that you made use of secondary data is not an excuse to echo the findings of others. Your findings is not another section for literature review. Your findings is full of citations. This person said this, that person. What are you saying? Because if you don't give us anything from you in your findings, your research is a waste of time. Because these people have already said what they said and they ended their research there. Now you want to push it forward. What is the new thing you are bringing? What are you saying? After looking at all their submissions, you don't need to echo them. Now come up with findings that are relevant for our practice here in Nigeria, like you stated that you were going to do. And I think another thing that created this problem is the fact that you moved directly from data collection, from stating your instrument of data collection to stating your method of data collection. And then from there, you went straight to findings. It cannot work. Instrument of data collection, well stated. Method, clearly stated. Then there's the gap of data analysis. How will you have findings when you've not analyzed the data you collected with your instrument? There should be data analysis. Because you stated your method of data collection, there should be method of data analysis and then the data analysis itself before you go to findings. So you may consider using the thematic arrangement for stating your analysis. After going through all the data you gathered, you can put them in themes in line with your research questions so that you present an analysis of your data. You can even use simple statistics to say out of 50, because you claimed to have used like 60-something sources to gather your data. You could use simple statistics for your data analysis. Like out of 60 articles, 50 submitted that child welfare services is available and accessible, 20 submitted that it's not available at all. You have to give us something to look at, something on which we can hinge your findings. So as it is now, I want to ask that you tidy up this very beautiful work by paying attention to these areas, maintaining your objective and research questions in line with your title, connecting your findings to your research questions, and providing a section for your analysis of data. Your recommendations are so good. I felt really inspired by looking at them, because if we are serious about taking our practice concerns out of the scope of just discussion into implementation, your recommendations are very, they have mapped out very strong paths that we can follow to achieve what we want to do. Your recommendations are practical, they are relatable, and practice-oriented. That is very good. And then your references are well arranged and well detailed. So I want to appeal to you one more time. Please, if you need me to clarify some other things, you can get in touch with me later. But please don't leave this work this way, because it has so much to offer social work practice in Nigeria. Thank you very much for listening.
All right, thank you so much, Dr. Vivian. We appreciate you. We know that you have always been inspiring, and in all you do. So, Group A, there you are. Please, you receive back your work, tidy it up, get in touch with your supervisor and mentor, that's Shaka Ferdinand Moja, and do a beautiful submission that could be published. Thank you and remain blessed. Okay, we'll be going to the last person now that we have been expecting. I saw her briefly. I saw her Insta, that's Dr. Naomi. I'm not seeing her on the participant list again. I know she came in, while Dr. Vivian was reviewing. Okay, so the last group now will be Group D. Group D to be reviewed by Dr. Chinyere Naomi Thompson, Dr. Sorry, just let me try and let me keep that with her. Okay, she will soon be back. The network logged her out, so she is trying to come back. Where she is, the network has not been friendly as well. Yeah, let's give her some few minutes for her to come back. Please let me just say this to group leaders and members. You are expected to have just one or two objectives. Your objective should not be more than two, maximum two, minimum one. So when you are going through your corrections, make sure you limit your objectives to two. If you have 3 or 4, just take away 2 and let it remain 2 and deal effectively with those 2 objectives. I hope we understand. I hope it's clear. So we're waiting for Dr. Naomi to come back. Okay, I think she's back. Thank you very much, Dr. Naomi. Thank you for your struggles with the network. So briefly before it locks it down again, we have Group D that you are reviewing. Dr. Naomi is works with Caritas Nigeria in Abia State. She's also the coordinator of the Chartered Institute of Social Practitioners of Nigeria, Abia State chapter. So we have Ezekiel Moses. Are you there?
Yes, sir. Good afternoon.
Okay, you have the floor, please.
All right, sir. Can I share my slide?
Yeah, please. You should share it. Yes. Please share.
Can we all see it, please?
The time is running.
Can we all see it, sir?
Not yet.
I've not seen it.
Yes, I can see it here.
I can see it. Oh, okay.
So, good afternoon, sir. My name is Ezekiel Moses, and I'm the group leader for Group D under the supervision of Dr. Sam Adekon. So, I have my group members here. I have myself, Mrs. Adekombi, Indi Freke, Mr.
Akombi, not Adekombi,
Okay,
Akombi.
Mrs. Akombi and Mr. Chibuiki. Sorry for the pronunciation. So quickly, I want to look at our topic, which is social work and disaster management in Nigeria. So we'll look at the roles, challenges, and opportunity. So quickly, I want to go to the introduction of this topic. You could see from my slide, we want to look at the practice of social work and how we manage disaster, which is disaster management. So Nigeria now, as a country of study, we have various disasters that we have faced over time. Example of such is flood, erosion, conflict, disease outbreaks, threatening socio-economic stability. So all of these, we are familiar with all of these that we can say, okay, happen and something we can talk about. So one of the first one that will just open our eyes to, we know the common one that is still around the corner is the COVID-19 outbreak that we had in 2020. You know, we call it COVID-19. So in 2019, 2020, till recently, you can see recently, maybe within last week, someone was still making, there are some news flying around that we still have a bit of outbreak. So these are the kind of disasters that are around the corner. So data have it that 5.2 million people in Nigeria are affected by flood in 2024 by NEMA, so National Agency, Emergency Management Agency. So they gave us this data. So we have displaced individual, like 1.2 across the country. So social workers now, our role as social workers, we are starting with the responsibility to see into how we manage all of these disasters. So we play a crucial role in addressing the human dimensions of these crises through counseling, advocacy, and community development. So for that, we'll take it as introduction to the topic. So we'll look at the statement of the problem. So for every problem, there's vulnerability and barriers to how we solve those problems. So the vulnerability is disaster disproportionately affects marginalized groups, exacerbating existing social vulnerabilities and leading to increased trauma and displacement. So disaster now, talk about flood, talk about all of that I mentioned earlier. So all of this will displace women, displace us, will give, there's a sense it poses to us. It makes us uncomfortable. It makes us unstable. It affects our properties. It can affect our mental well-being. It can affect a lot of things around us. Even people, affect our loved ones, affect our dwellings, affect our shelter. Those disasters, they come like that. So these are problems that we face, problem of social work. So the moment we have issues like this, social workers, we have a lot of roles to play in dealing with such kind of disaster. So the management is our core. We have a lot of role to play in managing those things. So barriers, we face a lot of barriers. So limited financial resources, inadequate specialized training, navigating complexity, bureaucratic system, complex bureaucratic system. So those are barriers to disaster management that we face as a social worker. So we look at the goals too. We enhance training and, sorry, I'm coming. So the goal is to, come in, I want to put off this. Okay, sorry, sir. Nice thing we share. So can you still see my screen? Can you still see my screen, please?
Yes.
Can't see myself, sorry. Okay. All right. Yeah. The goal is we collaborate, where we enhance training and collaborative framework, empowering social change, build resilient communities for communities to have capacity for recovery. So those are an area of the statement of the problem. Sorry, I'm coming. I was trying to turn this off. Okay. Impact
Okay, your time is up, Mr. Ezekiel. Thank you very much for giving that intro to your paper. We'll call on Jemiriye Jonathan to give this part B and C, section B and C aspect of the paper. Okay, you have the floor, Mr. Jemiriye.
Hello, sir.
Yes, please.
Can you hear me?
Yes, please. We can hear you.
Hello, sir.
We can hear you. Just go ahead. We can hear you. Go ahead, please.
Okay, sir. Thank you very much. God bless you, sir. I will speak about the theory and the theoretical aspect of it. In addressing the challenge faced by the vulnerable population during disaster, two theoretical frameworks stand out. The first one will be the resilience framework, and the second one will be the system theory. Under the resilience framework, we have things like adaptive capacity, which is the ability of individuals and communities to adjust to changes and challenges, which are essential for effective recovery. We also have community cohesion, strong social network and relationship that foster mutual support and collaboration during the disaster and even after the disaster. We also have empowerment, and that's the process of enabling enabling the individual and community to take control of their recovery, irrespective of what has happened to them. It also, in a long way, it will
Mr.
enhance their
Jemiriye,
recovery.
you are not looking into what you're supposed to be doing. Go straight to your theories and materials and method.
Yes, I'm in the system theory, sir.
Okay.
Yes, the system theory is one of the theoretical aspect of what we are going to talk about. The system theory talk about under the system theory, we are going to speak about the interconnectedness and the holistic perspective. The system theory says that it talks about the individual that stand as complex system of relationship and environmental factor. It emphasizes the interconnected of social, economic, and environmental elements that influence vulnerability and resistance. So key concepts of this system theory will include interconnectedness and holistic approach perspective. What is the interconnectedness part of it? This is to understand how the different system, that is the family. When we say system, we talk about the institution, the family, the community, the government, how they interact and impact individuals that had experienced such disaster. And under this system theory, we also have holistic perspective, which view individuals within the context of their environment, recognizing the challenge that are often multifaceted and require comprehensive solution. So under the study design, the study will utilize a qualitative research design to explain the role of social worker in disaster management, focusing on their contribution, challenges, and effectiveness of current strategy in Nigeria. The qualitative approach allows for in-depth understanding of experience and perspective of social worker and affected community. Our study population will be the individuals that are affected by disaster, and also will also be participants that are selected through purposive sampling to ensure that diverse range of experience and insight are presented. The data collection will be in form of interview. We are going to use focus group and document analysis. The interview will be a semi-structured interview. It will be conducted with social worker and community members to interact with them in order to experience the role of social worker in disaster management. We also have the data analysis. The data collected from the interviews and focus group will be transcribed verbatim and analyzed during thematic analysis. This process will involve the following steps. The first one will be familiarization. We will also have validation. Then we have team development. We will also have coding. Then the ethical approval, the ethical consideration, the ethical approval will be obtained from the relevant institutional review board before the data collection. Informed consent will be sought from all the participants to ensure that they understand the purpose of the studies. And anyone that wish to withdraw at any time is free to withdraw without any consequence.
Okay, thank you so much for that, Mr. Jemiri. Let's have the last speaker from that group before Dr. Nami will come up. Okay, do we have Nweke there? Okay. Alao Olubukola, are you there? Alao Olubukola, are you there? Akanbi Fatima, are you there?
Yes, sir. Yes, sir, I'm here, sir.
Okay, please, you have the floor to do the findings and recommendation.
Thank you very much, sir.
Okay.
This is the aspect of our paper on section D, discussion of findings that the role of social worker in disaster management. The findings from this study highlight the pivotal role that social workers play in disaster management in Nigeria. Participants emphasize that social workers are often the first point of contact for affected individuals and communities, that is the vulnerables, providing essential services such as counseling, resources mobilization, and advocacy. Their unique training enables them to address the psychosocial needs of disaster-affected populations, facilitating recovery and resilience. However, social workers face significant challenges in their roles. Many reported limited resources and inadequate training in disaster response, which hinder their effectiveness. The findings align with previous research indicating that social workers often operate under high-stress conditions, leading to burnout and reduced capacity to support those in need. Millian et al. 2019. Additionally, the bureaucratic complexity of disaster management systems can impede their ability to access necessary resources and support. The other aspect of our findings is community perspectives on disaster management. The focus group discussion revealed that community members value the support provided by social workers, but also express concerns about the adequacy of disaster management strategies. Many participants highlighted a lack of awareness and preparedness within their community, which exacerbates vulnerabilities during disaster. This reflects the findings of Adebayo et al. 2020, who noted that proactive community engagement is crucial for effective disaster risk reduction. Moreover, the study found that community cohesion plays a significant role in recovery. Participants emphasized the importance of social network and mutual support. This aligns with the resilience. Our recommendation. Based on the findings of this study, several recommendations can be made to enhance the role of social workers in disaster management and improve outcome for affected community. Number one of the recommendation is enhanced training and capacity building. Develop comprehensive training program for social workers, focus on disaster preparedness, response, and recovery. This training should include practical skills for navigating bureaucratic and trauma-informed care. It's another foster collaboration between social workers, government agencies, non-governmental organizations, and community leaders to create a more integrated disaster management approach. Establishing formal partnership can enhance resource sharing and improve coordination during disaster response. Another recommendation, the community awareness and education. Implement community education program aimed at raising awareness about disaster risk and preparedness strategies. Engaging community members in this initiative can empower them to take proactive measures and reduce vulnerabilities. Advocacy for policy changes. This posits that social workers should engage in advocacy efforts to influence policy changes that address systemic issues impacting disaster management. This includes promoting equitable access to resources and services for vulnerable populations. Utilizing technology for disaster management, which is another recommendation, talks about leverage technology to improve communication and information dissemination during disasters. Social workers can utilize social media and mobile applications to share critical information, facilitate support network, and coordinate responses. And the last under the recommendation, promoting research and evaluation. Encourage ongoing research to evaluate the effectiveness of disaster management strategy and the role of social worker. This will provide valuable insights for continuous improvement and inform best practices in the field. In conclusion, the finding of this study underscore the critical role of social workers in disaster management and the challenges they face in supporting vulnerable populations. By implementing the recommendation outlined above, stakeholders can enhance the effectiveness of social work interventions, foster community resilience, and ultimately improve disaster management outcomes in Nigeria. Addressing these challenges is essential for building a more resilient society, capable of withstanding and recovering from future disasters. Thank you, sir.
Okay, thank you so much, Group D. Thank you, presenters of Group D. We appreciate you for your presentation. We have Dr. Naomi Thompson in the house who will be reviewing. Dr. Naomi is the coordinator of C-ISOWN in Abia State. She works with Caritas Nigeria. So let's have your views, ma'am. Dr. Naomi, are you with us? Oh. Dr. Naomi. Let's just give me some few minutes. Let me tap her. She's in, but cannot hear her. Dr. Naomi, please unmute. You've not muted. You have muted your mic. Please unmute.
Hello, good afternoon, sir. Good afternoon,
good
everyone. Sorry, my network is actually not stable, and where I am in the village. Sorry.
Okay, please go ahead with your review, please. Please go ahead with your review. Please go ahead with your review. Please unmute and speak. Go ahead with your review, please. You have muted again. Unmute.
Hello. Once again, good afternoon, everyone. Let me start by appreciating the students who have taken out this time to put their research work together.
Maybe it is network problem. We can't hear you.
Hello, Doc. Seems the network has logged her out again. Been trying to get in touch with her. But while she's trying to come back, let me make a few comments from what was presented. I discovered from your topic, social work and disaster management, roles, challenges, and opportunities. I discovered that your paper have not been able to tease out the roles of social workers in disaster management, because that is very important for a paper of this nature. Are you with me? So it's important for a paper of this. It's important for a paper of this nature to be able to tease out the role of social workers, bearing in mind that social workers are in disaster management are part of the multidisciplinary team that is managing disaster. They are not solo, they don't work solo. And they are not major disaster managers, because to manage disaster, there are people who are, there are professions that are responsible for the management of disaster. But social workers complements what they do. One, in any area that is disaster prone, social workers do the role of advocacy there, sensitization, and all the likes. Let me take, for example, houses that are not well built. You've heard about houses getting crashed and killing people and things like that. You have heard about people building in swampy area without adequate architectural and structural designs that are compatible to those drawings. You have heard about where we have fire incidents and the likes like that, fire incidents, earthquake, any form of disaster. You have heard about that. And I wish even in this paper, you point out one disaster area that you are looking at out of this one that I have mentioned. You kept your paper open to just disaster. What disaster are you looking at? Is it fire disaster? Is it housing disaster? Is it disaster as a result of earthquake? Is it disaster as a result of flooding? So which one are you looking at specifically? You must be intentional about what you are looking at and not leave your paper open to all forms of disaster. You are talking about general disaster that you have not mentioned a particular one. Because by handling this type of research, you can do it for 1 year and you have not finished, or 2 years and you have not ended. Why? Because you have opened it up to general disaster. I wish you were looking at just one major area of disaster. And I wish you are teasing out the roles of social workers in disaster management, which includes, like I said, advocacy, sensitization. When an area is disaster prone, the first set of people that are to be released to work on that are social workers. Once technical people, engineers, environmental experts have identified an area or identify a building, identify a place, the next people that should go there are social workers as advocates, to advocate, to sensitize people in that area that this area is prone for disaster, this building on this street is prone for disaster, and begin to prepare those people who are within that building or in that area. Prepare them. Then work also with government to say, okay, these people, how are we evacuating them to where? For a remedial measure or a remedial protection. Because they will need housing, they will need shelter, they will need many other social needs. Those are the areas of social work in disaster management that you have not looked at. Once they have been able to look at that area, social workers have been able to work with the government or work with the local, state or federal government and been able to get a place for them to be relocated to, then you are doing your work as a social worker. And okay, let's see another scenario where the disaster just came as a result of an eventualities and disaster have happened. Then social workers will be looking at the victims of that disaster event, or the victim and the survivors, because during that period, some people may have died, some victims may have died, and some survived. Some may be hospitalized, some may be okay. Then what are we doing about those survivors? Those are the areas of social work in disaster management. So, and we're supposed to look at that. So those survivors, what are we doing about them? What are we doing about their family and significant others? What are we doing about the education of their children? What are we doing about those who have even died? How do we break the news to their family? And how do we manage what is left behind? Human resources, human left behind, and resources left behind. What are we doing about that? Those are the components of social work in disaster management. And I've not seen it in your work. So in a nutshell, in disaster management, social workers are a member of the multidisciplinary team of disaster managers. And you're supposed to bring out their roles. Once you bring out their roles and all those areas I've mentioned out, then you can talk about what are those challenges inhibiting them from performing those roles. And then look at the way forward, the greener areas of what could be. That's the opportunities now. So in a nutshell, you are looking at the threats, the opportunities of disaster management after you have been able to tease out the roles. And I've not seen it in this work. I didn't read your work. It is Dr. Nami that read your work, but from what was presented, having listened keenly to what was presented, I did not see all these areas that are mentioned as key and core areas of social work. And the fact that you have left your work to be wide open to numerous aspects of disaster. So everybody will be asking you questions, they'll be querying you. What about this one, this area? What about that area? It's like the bird of prey will descend on what you have provided. Everybody is taking away what they like. But in research of this nature, you don't allow your topic to be a bird of prey that everyone will just be landing on. You must narrow down to a particular area, a particular component of what you are discussing. You are discussing the major disaster management. Then you zero it down to what disaster management? Is it fire management? Is it house management? Is it disaster as a result of house crumbling? Is it as a result of flooding? Is it as a result of war? So you need to narrow it down. So those are the things I noticed in the course of your presentation. Thank you very much. I have not seen Dr. Bach. That must be a serious issue where she is. Anyway, by the time she is done, she will send to us what she has been able to do in the review, and we'll send it to the group leader. You will look at it and work also with your mentor, supervisor, to get the correction done and prepare for your publication. Is there anybody who wants to say one or two things from reviewers here? Social worker Ferdinand, do you have something to contribute to them? Social worker Ferdinand. Okay, thank you very much. If there's nothing again, that's the last group that presented. We appreciate you, Group D, for your efforts, for the good work you have done. We will get back to you, and we want to wish you a success as you prepare for your forthcoming examination that will culminate into your being inducted as a member of C-ISOWN and consequently be licensed. So group leaders ensure corrections are made. And if you want to publish your work as a group, you discuss that with your supervisor so that at least he or she can make incentive contribution to it, and then get in touch with Dr. Adejuma Adegboyega, who is the secretary to the committee in charge of the publication. He'll be willing and glad to receive your paper for publication. I think I'm not sure about how much it is now, but when you are ready, you get in touch with him. He will tell you how much you are supposed to pay for your paper to be published in the Professional Social Work Journal of the Chartered Institute. So thank you very much. It's been a worthwhile. I would like one of the group leaders to give a vote of thanks to our reviewers, and one other group leader will give a vote of thanks to our mentors, with our supervisors. So let's just do that briefly before we close. Thank you.
So good evening, everyone.
Good evening, sir.
Yes,
Good
sir.
evening, sir.
Yes, I want to, the group leader for Group B, I want to quickly appreciate let me start from our coordinator, our father, Dr. Atele, for his time, his response, guidance, and the coordination so far for this cohort. Thank you, sir, for what you're doing. And thank you for the review too. I want to quickly also thank our supervisors for their time. We noticed that they are busy. They've been busy, some on transit for a long journey, some busy with work, and we know this is weekend. It's not always easy. It's a moment for them to rest and look at other things, be with family members, but they chose to be part of this exercise for our success, for us to make meaning with our study. Thank you. We want to say thank you, and we wish to do this more with you, sir. God bless you, sir.
Thank you very much. Okay, one other group leader. Okay.
My name is Lorraine. I would like this very good work. I'm very impressed. I didn't know this was what the pattern looked like, but I'm glad I participated. Thank you very much, our supervisors. Thank you for standing by us and leading us and guiding us. Thank you very much. We pray the exams will be equally nice and easy for us to pass through, and we'll all meet at the certification ground. Thank you very much, sir. God bless you all.
Okay, thank you very much. Let me also at this point thank each and every person in each of the groups for the contribution of refreshments to our supervisors and reviewers. We thank all of you for your generosity. We appreciate you so much. Thank you, and remain blessed. And please do well in your exam and make us proud. And ensure that nobody has a carryover. You know that adult students don't fail exam, but nobody is ready to fail anybody. But then make sure you don't fail yourself. Distinguish yourself and make all of us proud. We'll be willing and grateful we'll be glad to receive you when you pass and you are invited for induction to see your beautiful faces. We've just been talking on phone, and that day of induction is always a warm period when we will now see all ourselves physically. We see ourselves physically, rejoice together and dance together, and marry together. So thank you so much for being here since 10 o'clock. It's been a day. So on this note.
Sorry, good afternoon, sir.
Thank you, sir. We appreciate you, sir.
Thank you very
Sorry,
much.
I want to ask a question concerning the articles. Actually, I'm a writer. I like to write and I like to publish, and I've done some, but I've not really heard on have any articles on social work. But I would like to, at least if I can be like having some kind of part in some of the articles, or maybe I can co-opt with any other one available to be published. I don't mind, sir.
Auntie Bimbo, you are handling our
I don't quite understand your question.
Okay, I'm asking if, okay, as a professionals, I'm thinking of maybe we can co-opt with others too to have an article published.
Oh, okay.
Or maybe there is any available one, maybe
yes,
about
like
to,
this.
or that you need to co-opt individual interested.
You mean apart from this one now?
Yes, apart from this one, I'm thinking of any other.
Oh, of course, there are many journals you can publish. There are many journals. Ours, no, because it's our program, we always love our students, our candidates to publish in our, this is a prerequisite as well, that each group that presents like this and have gone through this rigor, we should not allow you to just lay like that. So it's already is a group. So about 6 or 7, so which is okay. But if you want to publish aside of that, you have a paper of your own, maybe only you or you and one other person, you can also send it in. It will be accepted.
Okay, sir.
There will be peer review. There will be peer review of it. Even this one, there will still be a review of it. The journal committee will still, even when you submit this one that have been reviewed, the journal committee will still review it. They'll still see correction. So
yes,
and normally these days it's always good that you don't publish alone.
Yes, we co-op.
Single authors are not taken serious. We talk about synergy, cooperation. These days,
even I've done some, which is single one. There is no, I didn't get any citations concerning that. So the other one I've done with people, I think I have gotten so many citations on it.
Yes.
You know, people, scholars, and everything.
Group work is related. You know, they say 2 good heads are better than 1.
Yes.
That's the philosophy. Ubuntu. Because you are, I am. Because I am, you are. So what people put together, or 3 or 4 people, is better than what only one person.
Yes. Okay, no problem, sir. Maybe I'll get to you.
No problem,
concerning that, sir. Thank you, sir.
It's all right. You're welcome.
Hello, sir.
All right. Yes, please.
Now, this is Group E. When our supervisor was giving our instructions, the next one wasn't clear. So I don't know if my group members, they were able to hear anything. But for me, I didn't get anything. No, what she was outlining.
Don't worry. She's going to send back the work. So you see everything there.
Okay, sir. Thank you.
You're welcome.
Thank you most sincerely, sir. God bless you, sir.
Thank you.
Thank you for your time, sir.
Thank you.
Thank you
very much.
Thank you, sir.
Well done. Really appreciate.
Thank you. Thank you. Yeah. Thank you. All right. Bye.